please settle down. So good morning and welcome to the Nigeria Health Watch Policy Dialogue on Nutrition. Thank you all so much for being here. My name is Betty Baye. I am the editor at Nigeria Health Watch and I will be your anchor for the next few hours. So, I'm from Ugep in Cross River State. And when I was a teenager, I knew two streams. One flowed from rocks and then the other came from the ground. I found out a few years ago that both had dried up. Now my people are predominantly farmers, which means that the fact that those streams dried up and possibly a few others have affected the farmland around them. And this ultimately means that besides the farmland, it has affected the food security of the people who depend on the crop from the farms and eventually their nutrition. And so today, while the link between food security and nutrition is common discourse, we must elevate the more focused discussion on the intersection between climate change, food security, and nutrition. So over the next few hours, we are going to be having robust discussions on this intersection and the need for the integration of programs and policies across sectors. But before we begin, I'd like to recognize a group of people. Now, all the discussions that we're having today are powered by Nigeria Health Watch in partnership with USAID Advancing Nutrition Project, which is the USAID's flagship multi-sectoral nutrition project led by JSI Research and Training Institute Incorporated, and also Helen Keller International, an organization dedicated to saving and improving the sight and lives of the world's most vulnerable by combating the causes and consequences of blindness, poor health, and malnutrition, and also Global Alliance for Improved Nutrition Gain, a Swiss-based foundation with a mission to advance nutrition outcomes by improving the consumption of nutritious and safe food for all people, especially the most vulnerable to malnutrition. At this point, please permit me to also recognize the presence of the Federal Ministry of Health, the Federal Ministry of Agriculture, Water Resources and Rural Development, Federal Ministry of Environment, NAFDAC, UNICEF, the World Bank, Pathfinder International, and all of you here present. Thank you very much for being here again. And now, please help me welcome the Managing Director at Nigeria Health Watch and my boss, Vivian Ihekwezu, as she gives her welcome remarks and sets the stage for the discussion. Thank you.
Thank you very much, Betty, for that apt introduction. I think this morning, for us at this policy dialogue is an important opportunity for us to highlight and to have discussions around food security and nutrition in Nigeria. And I'd like to thank, as Betty did, especially our partners who supported us in putting together and partnering with us for this nutrition policy dialogue. And I'd like to recognize, standing on existing protocols, but also recognize some of the speakers who have joined us this morning. We've got Chief Urapa, who's the Director Head of Prevention and Control of Micronutrient Deficiency at the Ministry of Health, Dr. Michael Ojo, the Country Director for GAIN, Dr. Michael Adeboye, Deputy Director, Federal Ministry of Agriculture, Dr. Jane. Really pleasure to have you here. I know we were really keen to have someone from UNICEF from here, so we're really pleased that you were able to step in, and we look forward to hearing some of what you have to say about climate change. Dr. Jane Oloyode from FHI 360, thank you very much. Michael Daniel, the Technical Advisor, Helen Keller, welcome to have you here. And Dr. Olutola, Executive Director for Vista Health Foundation. We're really, really happy to have all of you here. And also our delegates who have joined us online. I know we're starting a bit later than we had hoped. We were waiting for some more of our speakers to join us this morning. So really happy to have an online audience as well with us this morning. On behalf of Nigeria Health Watch, we host these policy dialogues annually as an avenue for more than anything to convene and bring together critical stakeholders in the different areas that we work in. And for us, this one especially, we are very excited about the fact that we're able to bring on board stakeholders and ministries, not just health, but also agriculture and environment, in having this discussion today about strengthening nutrition outcomes in the face of climate change. I think for all of us, we are aware, and we see it, the impact of climate change in the different areas of work that we are focused on. And the impact on health and well-being cannot be overlooked. But not just health and well-being, but also the impact it has on nutrition and nutritional outcomes. Hunger and poor nutrition continue to be a very pressing global issue, and has cost and claimed many lives, not just in Nigeria, but around the world. And it has really hindered and will continue to hinder our ability to achieve the Sustainable Development Goals. We have these goals which are set that we hope to achieve by 2030. But the impact of climate change will continue to compound our ability to reach and achieve these goals. And in Nigeria alone, the devastating consequences of undernutrition has resulted in many children not even reaching their 5th birthday. So achieving SDG 2, zero hunger, and SDG 3, good health and well-being by 2030, really requires us to work collaboratively to address this issue head-on, recognizing that a healthy and nourished population is really the cornerstone of any economy, and any thriving economy, especially like Nigeria. Furthermore, the convergence of climate change and food insecurity poses an even greater challenge. We see this increasingly with farmers not being able to irrigate their crops. We see issues of crop failure, and the adverse impacts of climate change, such as droughts and flooding. Last year was a very unfortunate year in Nigeria, where at least 30 of our 36 states suffered from floods. And what does this mean? Farmers who have been growing their crops, rice farms, were devastated. So if we're talking about the challenge of even feeding the country, climate change will continue to compound this even further. And the livelihoods of farmers, who often may not have the necessary insurance to protect their crops, will obviously be adversely impacted. So the nexus really of climate change and nutrition is not just, it's not just mere conjecture. It's a formidable reality to produce sustainable and sufficient food and adequate nutrition. And changes in environmental conditions, including shifts in precipitation patterns, the temperature rises, these will all have reverberations on our ability to nourish our country. And it will impact on our children, children being born now. The impacts of climate change will adversely impact them if they're not able to have a nourishing and good diet. And it will impact on parents being able to feed their children. Food inflation is also a consequence of crop failures. So farmers are not able to get their crops to market, leading to reduced supplies in food. And all of these are having severe inflationary pressures on families and their ability to feed their children. So this cycle of poor nutrition will continue. And so this is why for us, this policy dialogue at this particular time is especially important. And really, in light of these realities, this dialogue will serve for us, we hope, as a platform to facilitate constructive discussions and develop actionable recommendations. And so today, during all our discussions with the 2 panel sessions we have, we hope that we can explore the impact of climate change on food security, and hear from the experts' views and opinions from the delegates and from the panelists that we have invited. And our objective really is to foster collaboration amongst the multiple stakeholders. For us at the work we do at Nigeria Health Watch, obviously we have our laser-eye focus on health. However, we recognize that to address a lot of these issues will require, multi-sectorial, multi-stakeholder involvement, not just in health, agriculture, environment, finance, and having avenues to bring all these different parties together, we feel is the only way to achieve, sustainable progress as we go forward. And obviously, many of us in this room are aware of the challenges and aware of the intricate linkages between climate change and food security. But as we navigate these complexities of this dialogue, the words of Mahatma Gandhi when he said that the future depends on what we do today resonate even more than ever. So each one of us, in the individual and collective work we do, we play a very important role in shaping the trajectory of the nation's nutrition landscape. And I'm confident that today's dialogue will yield fruitful discussions, actionable recommendations, and meaningful partnerships. And it's an important opportunity for us to seize the opportunity to work collectively towards a future where no child suffers from hunger and where nutrition is safeguarded for all. So I thank you all for your presence today and your commitment to this very critical issue as we embark on this journey of knowledge sharing and collaboration, and knowing that our collective efforts will provide us with the ability to shape a healthier and nourished Nigeria. And really, after this policy dialogue, we often convene these. We don't want this to be just, we come, we talk, and then that's it. We need to have actionable recommendations afterwards. What happens now? How do we use the discussions that we have today in supporting, of course, the different ministries in the work that they do going forwards? And how do we collectively understand how our work actually intersects and how collaboratively we can work together as we go forward? Because we are all aware that none of us can really do this work on our own. And it's only through our collective efforts that any progress really can be made. So I invite you all to engage in all the discussions, to listen, and to network with one another, since we're all convened here today. So I'll hand back to Betty, our MC, and thank you all once again for being here this morning.
Thank you so much, Vivian. And now please help me give a warm welcome to Chief Uruakpa John, Director and Head Prevention and Control of Micronutrient Deficiency, Federal Ministry of Health, as he comes to give his keynote address. You're welcome, sir.
Good morning, ladies and gentlemen. Let me stand or align myself with the existing protocol, because if we continue to sit on it, it might collapse. So my name's Uruakpa John. I'm a director with Federal Ministry of Health, and I'm here today to give my own opinion on the topic strengthening nutrition outcomes in the face of climate change. But I will start by appreciating the organizers of this policy dialogue for a timely, for organizing it, within the right time. Because looking around, we may think that climate change is far from us, but it is here with us, a big issue. And government alone cannot be able to do it. It will require the private sector, partners, collaborations, so as to address it. And such collaboration is what we are here today to witness. So I appreciate the Nigeria Health Watch for coming up with such a topic at this time. Okay, let me start. I think I have a few, I hope I have some time to be able to go through the few pages that I have here. But let me start by looking at a few definitions of climate change. I know all of us here are aware of what climate change is all about. But according to the Oxford Dictionary, climate change is defined as a change in global or regional climate patterns. This change is attributed largely to increased level of atmospheric carbon dioxide produced by the use of fossil fuels. And we know what fossil fuel is all about. Burning, and the carbon we emit from our industries, all those things are, affect the climate we're talking about. So climate change can also be referred to as a long-term shift in temperature and weather patterns. This shift may be natural or as a result of human activities, which have been the main driver, primarily through burning of fossil fuel like coal and gas, which produces heat-trapping gases. Currently, the world is already 1.2 degrees higher, warmer than during the last decade. This phenomenon comes with great consequences on the environment and destabilizes the ecosystem, hence adversely affects various food systems pathways that are integral for good nutrition, such as food production, dietary intake, health, social security, and water hygiene. Many countries, including Nigeria, are signatories to conventions, declarations, both at global and regional levels, addressing the climate change. Yes, a lot of activities are going on around the world to ensure that the menace is addressed and being controlled, and Nigeria is part of them. So as we go down the what I have here, we will look at climate change, food security, and nutrition. We're also going to look at what Nigeria is doing to respond to this change. And finally, I will make some suggestions required or needed to strengthen nutrition outcomes in the face of climate change. So these are the three thematic areas my address is going to focus on. So let's start from the climate change, food nutrition, and the food security. Climate change comes with attendant flood, drought, more intense hurricanes, heat waves, and wildfire, which can drive down crop yield, destroy livestock, and interfere with the transport of food. Rising carbon dioxide level from human activities, food systems at different levels, including changes in soil fertility and crop yield composition and biodiversity of nutrients. Looking around, we discover that all these things are here with us now. You can see the various hurricanes ravaging the European countries. You can also see or hear the wildfire that also consumes many farmlands all over the world. Even the incessant rain that falls. Even in Nigeria, going to the Bay States, the Northeast, you discover that a lot of the farmland are no longer arable. The desert is fast encroaching. The rain pattern have changed. The crops are no longer yielding the way they're supposed to yield. Even when they yield, the nutrient content is no longer the same. It's in fact affecting everywhere. But it's something that is coming in a subtle manner, and many does not know. the effect. But as we go down, I think our coming here today, we kind of awaken our consciousness on what climate change and the danger it poses for the whole world, and in particular in Nigeria. Climate change impacts almost every aspect of, starting from rising global temperature, shifts in precipitation patterns, and increases in the intensity of heat waves and the frequency of extreme weather events adversely affect various systems that are integral for food nutrition. Our region, Africa, already harbors a high prevalence of food insecurity and a double burden of malnutrition characterized by coexistence of undernutrition, macronutrient deficiencies, as well as overweight and obesity. Therefore, it is believed that the prevalence of food insecurity and the burden of malnutrition will be further worsened as climate change continues to unfold in the region. Yes, if you come to the world, Africa, and in particular West Africa, are the worst hit if it comes to nutrition or food insecurity. Then with the prevalence of climate change now, you can think or imagine, if nothing is done in Africa in general, where we are heading to and what will happen in future. And that is why we are also here today to provide some solution on how to go about it. Okay. More vulnerable communities will be at a higher risk of food insecurity as direct consequences on productivity, migration pattern, nutrition, and health. Yes. If we take a move to the Bay States, there's a places we call the Bay States. That's the Northeast. We discovered that a lot of people are even migrating from that place down to our side now. That's why you are seeing a lot of people in the Southwest, Southeast, South, saturated, because they are searching. Even their animals, they're all searching for food. Because desert is encroaching as a result of climate change. So even food insecurity is there. We are not even talking about the human insecurity that is also ravaging Africa. Then climate change is the biggest challenge facing both our future and the future generations. Various models predict alarming atmospheric changes as a result of climate change in a world where undernutrition is declining very slowly and the overnutrition is increasing rapidly. Some of us may imagine how. Yes, overnutrition is also a problem. And if you look around, like if you travel to places like America, you discover that some people are too fat, extremely fat. In fact, I saw one in New York. I couldn't believe somebody can be that fat. And even in Nigeria here. So all these things, as a result of climate change, has a hand in some of them. In a world where undernutrition, okay, the effect of climate change on nutritional status are expected to be multifaceted and severe. The Lancet termed this global synthetic of obesity, undernutrition, and climate change. There is evidence that climate change reduces nutrient level, like protein, iron, and zinc in plant foods, particularly cereals and legumes, as a result of increased level of carbon dioxide in the atmosphere. It has been established that increase in atmospheric carbon dioxide will decrease growth in global availability of nutrients by 19.5% for protein, 14.4% for iron, and 14.6% for zinc, relative to expected technology and market gain by 2050. Cereals crops are the main source of protein and macronutrients in many low-income countries. You can imagine, if we are talking about increased nutrients in our foods, and we are being told that by 2050, climate change will decrease nutrient in protein by 19.5%, and that of iron 14.4%, and that of zinc 14.6%. You can imagine what will happen by then if nothing drastic is not done. Climate change affects all aspects of food security, availability, access, utilization, and stability through diverse impacts on crops, pests, diseases, weeds, pollination, forests, livestock, and aquatic food sources. You can imagine all the source of nutrient, food, is being affected by climate change. Everything, even the pests that we can see. Okay, I was listening to news, it's not 2 or 3 days ago, down Maiduguri. They're saying weevils or insects are consuming all the crops, the rice. Why? These are all climate change impacts. Imagine a whole farmland being consumed by weevils, pests, all these insects. What is left? Nothing. We are going to harvest nothing. And that portends danger, because there is increased food insecurity. So something has to be done. Okay. For food production, okay, yeah, decreasing yield and changing the sustainability of areas for food production. Climate change also increases the risk of foodborne and waterborne diseases, and vector-borne diseases will increase, further impacting nutrition as a consequence of warmer temperature, extreme weather, and shifting precipitation patterns. In 2019, unusual weather conditions exacerbated by climate change created conditions conducive to a desert locust outbreak, which destroyed food and vegetation and jeopardized food insecurity. Just as what I said earlier. That one is 2019. No, this one is 2019. With what I just said earlier, just last week. So it has become a recurrent decimal. Good. One of the key drivers of biodiversity loss in agriculture is climate change, which in turn reduces the ability of the food system to respond to shock and stress. Climate change also reduces access to food, thereby increase the price of food. Food prices are extremely sensitive to shock on both the supply and demand side, as demonstrated recently by the COVID-19 pandemic. Fluctuations negatively affect household food availability, access and diet quality to social and health services, and the quality of infant and young child care. Yes, when there is too many people chasing too few food available, what does it result to? High cost. It becomes those that have the money can feed. And you know what it portends? Nigeria already have almost 60% of the population poor. And when this type of situation now comes to us, what will happen? It means we may have almost 80%. Maybe some of us here will be the one to survive, and our relations will not survive, because there is no food to go around. And where there is, it's very, very expensive. So one of the, now, what is the Nigerian government doing to respond to climate change? And I think with this, what I'm going to let you know what we are doing, we are also going to assess some solutions to assist government to ensure that we are food secure and nutrition secure. Okay. Being signatory to many conventions, declarations, both at global and regional level, addressing climate change, Nigerian government has commenced initiation and implementing policies and processes to address it. In November 2021, Nigeria passed the Climate Change Act. The act includes provisions to adopt national climate change actions, plans in 5 years cycle, which seek to achieve low greenhouse gas emission and sustainable growth by providing a framework to set a target to reach net zero by 2050 and 2070. This is what the Act is seeking to achieve, that by 2050, we will have zero gas emission in Nigeria. Let's hope God will help us to achieve that. The Federal Ministry of Environment, Department of Climate Change, developed the National Policy on Climate Change, which is the Climate Change Policy Response and Strategy document for Nigeria. The mission is to strengthen national initiatives to adapt to and mitigate climate change in a participatory manner involving all stakeholders and sectors of Nigerian society, including the poor and other vulnerable groups. The agriculture and health sector in the policy document emphasizes on food safety, food availability, climate-related diseases and its implication to health, including undernutrition, obesity, diet-related non-communicable diseases. In recent years, policies in nutrition have indirectly attempted to apply measures by effective collaboration with ministries, agencies, and development partners to preempt the impact of climate change. This is evident in the recently reviewed National Strategic Plan of Action for Nutrition 2021 to 2024, where one of the key objectives is to ensure community participation for nutrition interventions that would strengthen collaboration among partners and other stakeholders, by 31st of December 2024, including Federal Ministry of Agriculture and Rural Development, Ministry of Environment, Ministry of Information. In the transformation pathway, one of the priority actions of the Federal Ministry of Health in the National Transformation Call to Action is to develop the food-based dietary guideline and nutrition education, among others. The food-based dietary guideline will mitigate the effects of climate change on biophysical and environmental drivers, which will affect the various sections of the guideline, such as food supply chain, consumer behavior, diet, and etc. The National Food System Strategy document currently being developed clearly points out the objective of developing a national framework for the application of climate services, which is the domestication of global framework by WHO. The key ministry is the Ministry of Agriculture in collaboration with the Ministry of Science and Technology, Ministry of Information, Ministry of Environment, and other relevant stakeholders. The Federal Government of Nigeria, through the Nutrition Division, is also collaborating with development partners and other relevant ministries, agencies to develop the National Guideline on Nutrition in Emergency. The guideline will provide strategic direction and guidance on efficient delivery of nutrition services during emergencies, natural disaster, man-made disaster, and human crisis. To support nutrition program plan in 6 states in Nigeria, including, to support nutrition programs during emergencies, the Nutrition Division established a nutrition emergency response plan in 6 states in Nigeria, including Borno State, Adamawa, Gombe, Bayelsa, Akwa Ibom, and Yobe State, which involve in the nutrition emergency, prone areas. Effect of climate change such as drought, flooding, including other natural and man-made disaster. This is exactly what the federal government for now is doing in order to address this issue of climate change. And then what I suggest that could be done to strengthen nutrition outcomes in the face of climate change. So we look at governance and leadership. There is need for governance and leadership in Nigeria to ensure nutrition is addressed in climate resilient development and national climate change processes, plans and programs. They need to include climate change solutions in all the programs and activities of government in Nigeria. There is also need to increase policy coherence and multidisciplinary collaboration at local, regional, national, and international level to enhance food chain sustainability and local access to adequate nutrition. I think our government is doing this because they are signatories to many of the declarations as regards to climate change globally, regionally, and also in Nigeria here. There is also need to promote rights of vulnerable people to essential livelihood resources, including land rights and access or protection of fishing or farmland. There is also need to promote national commitment to shift towards healthy, sustainable diets. Then we cannot also overlook the importance of financing. There is need to mobilize existing and emerging climate fund to support nutrition, focused adaptation actions, and target most vulnerable populations, such as women and children in communities most at risk of undernutrition. There is also need to ensure that national adaptation plan include adequate budgetary allocations to address nutrition problems. That one is under governance and leadership. Then this one I just spoke now is financing. Then we look at capacity and awareness. There is a need to raise awareness on nutrition and climate change among decision makers and policy makers, because some of them are not aware that climate change is here with us. So there is need, I know, and I believe the essence of our coming here together is one of it. Because by the time the press or we come up with a declaration from here today, the policy makers will get to know about it. And there's also need to build clinical and community-based management capacity of undernutrition so that we'll be able to know who and who the households that are most vulnerable. Health personnel trained in the use of climate information and early warning system. Yes, the capacity of the health personnel should be trained on the needs for climate information and early warning system. There is also a need to promote gender equity and girls' education. And I have to add, the male education should also be involved. Because the way we are talking about this gender, men is going into extinction very soon. Yes, maybe by 2050, none of us will not be here again. Dr. Joe will not be here. All of us, our children will not be here, including me. But women will take over. So men, this is a clarion call. Okay. Then there's need to support the development of strong institutional frameworks and human resources to implement nutrition-based agriculture. Then service delivery. There's need to implement short-term emergency and seasonal safety nets that are gender sensitive, such as food and cash transfer and the finance initiative to increase financial access to foodstuffs. This is where I really appreciate our partners here in Nigeria. This is on board. The cash transfer, trader money, and so many other things. So we really appreciate them here. Nigeria is doing something. You can see that Nigeria is doing something. Is it not true? Good. Our partners are here. They can attest to that. That's need to use school-based approaches, school feeding programs, school gardens, nutrition, education, to include considerations of climate variability and long-term change into existing nutrition initiatives. We are also on board on this at the school feeding program. There is also need to provide education on healthy diet and sustainable food system, develop nutrition early warning and early response system, and improve contingency planning. Then on information, we have to refine the understanding of potential impact of climate variability and change and national nutrition, including for high-risk population and areas seasonal to nutrition risk. Identify the effectiveness of interventions to promote community-level nutritional resonance to climate change. Conduct participatory nutrition-focused risk assessment and risk reduction plans. There's also need to strengthen surveillance system, health and environmental. There's also need to improve the use of nutrition early warning, so early response system. We need to use it. Then the last but not the least, technology. Technology does need to integrate farming system exploiting synergies of horticulture, aquaculture, and small livestock rearing to reduce waste and expenses on agricultural inputs and increase food production diversity. There's also need to promote renewable energy use, such as biogas and solar. Seek alternative energy sources to hydropower that may be unavailable during periods of drought. Promote strategies that aim at reducing the food sector carbon footprint through sustainable food production and food consumption and waste reduction. Well, in conclusion, I can say that climate-smart agriculture, sustainable and resilient food system, information, adequate funding, and education are needed to ensure sustainable diet that are adequately diverse, nutritious, and better aligned with contextual ecosystem functions and environmental conversation. At this point, I say thank you for listening.
Thank you so very much, Dr. Uruakwa, for sharing your thoughts with us. It was interesting to hear about all that the government has been doing, and I'd also like to reiterate your recommendations, which include improving governance and leadership, increasing policy coherence and financing, and improving capacity and awareness and technology. Thank you so much. Now, the next item on the agenda should be success stories from multi-sectoral interventions, but we received the videos too late to play today, and so we're going to skip them. At this point, I'd like to leave you in the very capable hands of Kemisola Agbaye, Director of Program at Nigeria Health Watch, as she moderates the panel discussion on exploring enabling environment for the integration of climate change, food security, and nutrition policies for improved nutrition outcomes. Help me welcome Kemi.
Good morning. Oh, I didn't realize I was this much taller than you, Betty. Good morning, everyone. And thank you for being with us this morning. I know that climate change isn't a very topical issue right now, yet. I'll emphasize yet in Nigeria, because there isn't a lot of understanding about the topic. Well, you came, which means you're probably ahead of a majority of Nigerians, so please put your hands together for yourselves for being here. Okay, so this panel discussion will explore the enabling environment for integrating climate change, food security, and nutrition programs, and how they all work together to improve nutrition outcomes of mostly our children, but general nutrition outcomes of Nigerians. And I have on the panel with me people who are very well positioned to discuss this and to tell you what they are doing, but also what the enabling environment has been like and how they are able to integrate climate resilience in nutrition programming. So allow me to welcome first to the stage Dr. Michael Ojo. Okay, apologies. I'm Yoruba, but for some reason I thought that wasn't a Yoruba name. Okay, please welcome Dr. Michael Ojo, who is the country director for GAIN Nigeria. GAIN Nigeria is a global foundation that addresses malnutrition through public-private partnerships, and he has nearly 20 years of experience in public health and development. He has held senior management roles across West Africa and in the UK. He focuses on transforming Nigeria's food systems to make healthier choices accessible and affordable, and he'll be telling us a lot about what they have been doing at GAIN. Please put your hands together for him again. GAIN is also one of our partners for this dialogue. So yeah, this wasn't a preferential thing at all, but it's just, and we're really, really grateful for the partnership. All right, please welcome Dr. Jane Bevan, who is the Chief of Water, Sanitation and Hygiene at UNICEF Nigeria. She has over 25 years of experience in the water sector. She has collaborated across sectors with the World Bank, with NGOs, with government, with academia, with the private sector. And she played a crucial role in implementing the community-led total sanitation approach across 24 countries in West Africa. She'll be sharing her thoughts around how WASH how WASH interventions help to strengthen nutrition outcomes in the face of climate change. Please welcome her once again. Thirdly, please help me welcome Dr. Aliyu Musa Yauri, who is the Deputy... Sorry, Okay. Dr. Aliyu Musa Yauri is not here yet, unfortunately. So I'll just skip to the next person. Help me welcome Mr. Chukwuma Anene, who is Senior Program Officer at USAID Advancing Nutrition. He has over 20 years of experience, played a crucial role in designing and implementing impactful initiatives addressing HIV and nutrition challenges. And he excels in providing strategic guidance and leading program implementation. He'll be sharing his thoughts around how he has done that in ensuring climate resilience programming for nutrition outcomes. Thank you. So I would take my seat now. Okay. So like I said earlier, this panel is basically exploring the enabling environment for integration of climate change, food security, and nutrition policies for improved nutrition outcomes. And to kick off the conversation, really, I would just like to turn to Dr. Michael Ojo, who is country director at GAIN International. And I know that you already do a lot of work around strengthening nutrition outcomes and food security. And one of the key things that you emphasize is the need for innovation. Given everything we've heard about climate change and the threat that it poses to nutrition outcomes right now in Nigeria, how in your programs and in your interventions, how are you integrating climate change actions in your programming and in your practices for improved outcomes in nutrition?
Thank you. Thank you very much, Gbemisola. I hope you can hear me. I'm trying to find a way not to turn to the mic. Okay. Thank you. Thank you for inviting me to speak. And actually, the first comment I wanted to make is how refreshing and how encouraging it was to hear Chief John talking about climate change, being a nutrition person for the Ministry of Health, and talking about it with so much conviction and intent. I mean, for me, that means things are really moving in the right direction, which is fantastic. How is GAIN integrating climate into our nutrition work? We at GAIN, we set out a new 5-year strategy actually from the beginning of this year. And beyond the focus that we've always had on making nutritious and safe foods more accessible, we really wanted to really expand that into really working on healthier diets, which is about not just access to nutritious and safe foods, but also thinking about reducing access to bad food, but doing that in a way that is sustainable and is healthier. And the second big thing that we also focused on in that strategy was actually, making environmental protection core to the work that we do. So advancing climate change and sustainability in terms of the work that we do as an organization. And why did we decide to do this? We talk in terms of 3 C's. And the first of those C's is COVID. As all of us know, COVID really changed the way that we think and work and the way that food systems and supply chains work. It changed it and it's changed it forever. And we all have to respond to that in the way that we program. The second was crisis. And crisis in the context of Nigeria, I think all of us can relate to the implications of the crisis that we have in different parts of the country and how that affects our food systems. But even beyond Nigeria, we see what the crisis in Ukraine and Russia is doing to world food systems, to grain supply, to edible oil supply, and so on. So crisis was a big driver. And the third of those 3 C's was climate. And in our strategy, we actually make a statement which basically says that we want to design and implement our work in a way that really engages with the climate and make GAIN. We want GAIN to be seen as the leading nutrition organization from a climate perspective, not just so that we refine the work that we do, but also to influence the sector. And so for us, that was a strategic decision that we made. John already spoke about some of this, the things behind this, but if I can have a minute just to put some figures behind some of those broad shifts that he talked about. We all know that carbon dioxide CO2 emissions are going up. We know that temperatures are rising. We know that rainfall patterns are changing. Seasons are changing. We know that we see extreme impact or extreme expressions of climatic events, whether that's droughts or floods or heat waves or and so on and so forth. And we see sea levels rising. All of that is leading to crop yields going down, as John already mentioned. Arable land available for food production reducing, as John already mentioned. Micronutrient content of foods, of plant species dropping, food loss and waste going up, and the productivity of labor, especially food system labor, also going down. And all of this, including threats to livestock production, are showing up in impacts that we see. Food production is down 10% globally. Sorry, it will be down, it's down, and it will continue to go down as we go towards 2050. Crop yields are reducing by between 12 and 37%. And if we do nothing by 2100, we will see those food crop yields go down. Rising CO2 will reduce the concentration of proteins and minerals, like John already mentioned in his presentation. And all of these things are basically leading to hunger, to malnutrition, and to increasing food shocks, and which is leading us to more food and nutrition insecurity. So, what are we doing as GAIN? We had to, like I said, really focus our strategy on this so that we can secure co-benefits between nutrition and climate change. And we structure our work around 9 programs. And so we mapped those, the projects under those programs, about 120 of them across our organization, to really see where the opportunities were for us to secure this climate and sustainability goals alongside nutrition goals. We recruited a team. Now we have 3 people. And we did that because it's important for us to build our capacity, to help us develop our approach, to raise awareness internally, but also to build that capacity for us to be able to turn our intent into action. We currently have 3 people. We have plans to increase that to 8. We screened all of our projects globally, or we're in the process of screening all of our projects. And that screening is, again, to help us to understand the environmental risks and opportunities from the work that we do across our country projects. So that has helped us to categorize our work into 3 levels. The first level are where we see explicit dual nutrition and climate impacts that we can work on. We have a few of those projects in our portfolio. Then we have some projects on the second level, which is there's at least one significant co-benefit that we can see. And then all of our projects, like I said, on the third level are screened. And so these projects sit in a number of different action areas. So if you think about an action area as access to healthier diets for all within planetary boundaries, we are working with the government of Nigeria on the food-based dietary guidelines, which again John mentioned. We're working with the government of Nigeria on a nutrient profiling system. These are 2 projects which are mitigation for climate change. We're also working across many states in the country currently and across many of our countries globally on biofortification, which is replacing conventional staples with nutrient-enriched staples, because most of our people depend on these staples. And so making that accessible to them is an opportunity to improve their nutrition, but also adapt to climate change. If you think about the second action area as how food is produced, supplied, and stored, we have a whole range of projects that fall within this, and a lot of that is connected to the work we do with business, with SMEs, through our leadership of the Sun Business Network, where for a business to be part of the network, you have to make a commitment, a nutrition commitment. And some of those nutrition commitments are actually focused on adapting or mitigating climate. And so that's an area and also the broader work that we do around business support, working on innovation, like you mentioned, looking at climate smart business models, which could be in production, working with SMEs who are looking to improve yield or automate processes, to SMEs who are changing the composition of what they produce to ensure that it's providing healthier diets. We work on financing under this action area, and some of that is a whole range between some small grants that we provide to a project that we will be launching later this year, which is our nutrition financing facility, which provides impact funds to support bigger businesses who are looking for this kind of investments. And the reason why that's important is because one of the key metrics that we use to measure whether we invest or not is climate. And so there are 5 areas that we look at. One of those areas is climate, and we have indicators within that, looking at carbon emissions, looking at how they manage waste, looking at what kind of resources they use, whether there's fresh abstraction and so on. And if you think about another action area is how food is consumed, then we've been doing quite a bit of work on a post-harvest loss allowance for nutrition in Nigeria, where we brought hundreds of public-private partners together to really begin to tackle post-harvest loss, because 40% of the food that we produce is either lost or waste between the farm and the table. That has now led to a private sector-led organization called the Organization for the Technological Advancement of Cold Chain in West Africa, which is now advocating and really supporting the sector to draw investment and to push government policy. If you think about an action area around how food system data is used, we're working on a dashboard with the federal government of Nigeria, building on what we've done on a global food systems dashboard, which will help us to understand how food systems are operating, not just at the national level, but also at state level. So some of these projects are the things that we've been working on across a whole range of areas, which help to mitigate, to adapt to climate change, but also are really looking to secure co-benefits between nutrition and environmental sustainability.
Thank you so much. That was quite comprehensive. And we all know that when we talk about the health co-benefits of climate action, nutrition is right at the top of that list. That's really what is the basis for solving some of the issues that come out of climate change and how it affects our health. So thank you for sharing those. It was interesting to hear you talk about your work around safety, ensuring safety and sustainability, biofortification, financing. That was actually really pleasing to hear, given the general issues that the Nigerian health sector has with financing. It was also interesting to hear about your work with the private sector and reducing food waste and loss. I will come back to you to talk about how enabling you found the environment in implementing all of these interventions and in your work with the Federal Ministry of Health, and how you have worked with other MDAs that are like the Federal Ministry of Environment and Agriculture and Rural Development. Thank you so much. So I'll come now to USAID. So you also have some very innovative programs that you're running that aim to improve nutrition outcomes, such as the USAID Advancing Nutrition Project, which kick-started in September 2021. And it has a vision where communities and families are well-nourished and are resilient and able to thrive. Can you tell us how you have integrated climate resilience in the design and implementation of this program, please?
Yeah. Good morning, everyone, once again. And commendations to all the speakers so far. It's been very enlightening. Let me just get this out of the way. Just think of all the things that Dr. Ojo has said. All the things he said they do, USAID facilitated it because we provide funding for all those activities. In terms of climate change, I'll start by saying that the American government is the biggest supporter of the climate change agenda. If you listen to the speech by President Biden at the last UN Congress, he made an allocation of close to $6 billion for HIV, TB, and building resilient communities who would withstand the effects of climate change. So USAID, being an arm of the US government, carries this bastion forward. We prioritize and lead efforts to address climate change globally and in Nigeria. And we also have a strategy for addressing climate change, a 2022 to 2030 climate strategy that guides the whole of the agency's approach to reducing global greenhouse emission and help partner countries to build resilience and on climate change. We have a point of contact across all our portfolios that addresses climate change, and this guides all our climate change action, coordination, and even our stakeholder engagement. So back to your question. So how do we integrate climate change into our nutrition programs? First of all, we use an integrated approach. The project, the USAID Advanced Nutrition Project, recognizes a complex relationship between climate change and nutrition. So while we're implementing nutrition programs, we have climate change at our rearview mirror and around us. So we recognize that we understand the impact that climate change has on food systems and on the availability and access to safe and nutritious foods. And that guides our overall approach. Part of what we also do is what Dr. Ojo and, or what we promote is what Dr. Ojo and the Director of the Federal Ministry of Health mentioned. We aim to build resilient food systems in our approach. You know, the project aims to enhance the resilience of food systems by promoting diversified and locally adapted crops and supporting sustainable livelihoods and improving post-harvest management practices to prevent food loss and also waste. And we also emphasize the promotion of climate-smart agricultural practices, which go a long way to mitigate the impact of climate change. I will hone in more in this regard. Even though we have other programs like the Feed the Future program, which is more expansive in its attempt to mitigate climate change through its activities. In terms of advancing nutrition, what we have sought to do is enhance the capacity of smallholder farmers by exposing them to new technology, exposing them to good agricultural practices, such as diversification, introducing them to climate-resistant seeds and livestock, and also helping them learn sustainable farm practices that will not only help them increase the efficiency of their production, but of course taking into cognizance the reduction of damage they do to the environment while they harvest or yield their crops. Lastly, the Advancing Nutrition Project is a multi-sectoral program, and through this project, USAID is building a juggernaut of partnership. You know, this partnership and advocacy where we actively collaborate with government, with the private sector, other multilateral and bilateral partners, and even community-based organizations, households, and direct beneficiaries. So through these advocacy efforts, we raise awareness about the linkages between climate change and nutrition, and we also encourage policies and actions that prioritize sustainable food systems and improved nutrition outcomes. Much like the one that the director mentioned, the UN Food System Pathway. We're very active in promoting such policies because we know the good that will come out of that if Nigeria gets fully on board. So by engaging in partnerships and advocacy, we aim to create an enabling environment for immediate and long-term sustainable solutions to climate change and nutrition challenges.
Thank you so much, Chukwuma. Thank you for sharing those. Interesting to hear about your multi-sectoral approach and how you engage with communities. I would be keen to actually hear some of your insights on how communities have engaged with you and what kind of response you've gotten, what you've had to do to rapidly build capacity given the dearth of data and knowledge on this area of work specifically. But if we have time, I'd like to hear those. But before we go into policy proper and what the enabling environment has been, I'd like to hear from Jane. Jane, you are chief of the WASH section at UNICEF Nigeria, and you play a crucial role in ensuring that water, sanitation, and hygiene services are available across levels, especially when it comes to the well-being of children. What initiatives have you undertaken to address the intersection between nutrition and some of your WASH interventions?
Thank you so much for the question, Kemisola, and I'm quite sure that none of you really expected a WASH specialist to be on the stage here today, but I think as Vivian said right at the beginning, we need to think cross-sectorally and we really do need to work together, and hopefully this is one small step towards that approach. It's very clear that we all need to think multi-sectorally about some of these issues. And I think at UNICEF we're ideally placed, having all the different sections affecting children there. And indeed, we have worked closely with nutrition around some of these issues. Now, you may not know this, but whilst water coverage in Nigeria is quite good, the sanitation coverage is pretty appalling. It's estimated that there are 50 million people, that's almost a quarter of the population, that do not have access to toilets. And that means there is a huge amount of open defecation. It's pretty gross, but it's a reality. And this means there's a lot of poop in the environment everywhere. And this inevitably affects our health, and particularly the health of children, particularly those children that might be crawling around on the ground and putting dirt in their mouths and all the rest of it. So it's a really, really closely linked issue with malnutrition, with stunting, and we cannot address all of those unless we address the sanitation coverage. You may know that there is something called the Clean Nigeria campaign that's promoting sanitation coverage, and that's something that UNICEF supports very closely. And in UNICEF, we have mapped some of the areas of high open defecation and high malnutrition, and surprise, surprise, there's a really close correlation. It's inevitable. Obviously, these are some of the multivariate aspects of poverty, but it is inevitable that wherever there is very high stunting, one of the key underlying causes is poor sanitation. So, and hygiene, I should say, hand washing, often because of lack of water, not because people don't know how to do it. In fact, our data shows us that 99% of Nigerians know how to wash their hands. That's everybody. Yeah. But only 8% practice. Yeah, 8. Wow. Can you believe it? It's just not a thing. People aren't washing their hands. I'm not quite sure why, but we're looking into that and we're trying to find out some really good advocacy approaches to improve hand washing coverage. It's so simple before food preparation. I know nutritionists promote it, but it's not happening enough. So yeah, WASH is often using nutrition indicators to target where we work in the country, and that particularly, I think, in the highest areas of malnutrition, often in the north of the country. And wherever there is high malnutrition, but also other health indicators such as low immunization coverage. We're working not only with communities, but with health facilities and schools to increase WASH coverage, and particularly sanitation coverage. I would say in short that that's where we work closely together. I can give more examples. For example, in the Northwest, where there are therapeutic feeding centers for nutrition, we're working very closely with all of those centers to ensure that the WASH is included. That's just an example of one of the areas. But I think in the first 1,000-day approach of nutrition, because you know this area, the window, if you like, of children being most affected, WASH is a key component there, that hygiene and safe water around child growth and child protection really needs to happen to make sure that children have every best possible start in life and are not stunted. Thank you.
Thank you so much. And, oh, please clap if you want to. Great. And, we know how the relationship between climate change and WASH is very clear for everyone to see. We know how hard it is for people to get potable water when the floods come in or with the drought in the north. So we know what the clear link is between climate change and WASH. But thank you so much for explaining the linkages between nutrition and WASH. Really important that we know that it's all linked, it's all connected, which is why we all need to work a whole lot more together. So it's actually really good that we have you on this panel. Thank you. Okay, so now let's talk about policy and the enabling environments. Dr. Michael, you spoke about the work that GAIN does. What has the environment been in terms of laws, regulations, financing? How sustainable are these programs and these interventions that you have been supporting?
Thank you very much. So I think, in Nigeria, we don't have a shortage of laws and policies and strategies and so on. What is always a problem is actually the implementation of those policies and strategies. And I know when John spoke, he said one of the targets that Nigeria has committed to was net zero by 2050. And I chuckled a little bit because I don't know, I can't see what we're doing in actionable terms really to push us towards that. That's only a few years away. It sounds like 50 years away. And I think sometimes, we've talked a lot about how environment affects some of the areas that we've talked about, food systems, and WASH and so on, health. Maybe sometimes just having a bit more clarity about how some of these other systems affect our environment will help us to really get a sense of the urgency. For example, 40% of all of the arable land that we have is actually used for agriculture. That's a big chunk of our land space. 70% of all water that we abstract or we withdraw from our water systems, freshwater systems, is targeted towards supplying the food system, agriculture system. That's a huge amount. 70% of biodiversity loss on land and 50% in water is as a result of food systems interactions. 80% of deforestation that's going on is because of food systems. And so on. So I think it's really important, once we really get our head around some of those big numbers and big issues, that we get down to the brass tacks. The decisions that we make about what to eat, how that food is produced, how it's sourced, how it's processed, and so on, they all have profound implications for the environment and also for nutrition. And so it affects our ability to mitigate or adapt to climate change. And so it's really key for us to bear that in mind. And so I think in terms of the environment, there is a lot of work going on. We've heard about the food systems transformation pathway, which is focused on supporting nutrition and food security, but also really helping us to understand the impact that the food system is having on our climate and environment, and how we mitigate that as we think about expanding access to food and nutrition for people. We have a growing population. We're projected to be, I think, 400 million by 2050, if we do nothing. And all of those people have to be fed. So there will be an increased demand on all of these things I've talked about: land, water, all these resources. And it's really important for us as a country and as a people to be thinking very hard what this is going to look like. Otherwise, John's prediction might come to pass that some people survive and others don't survive. But we don't want to get to that position because we have opportunity. So sustainability will depend on a whole range of things. And I think in terms of the enabling environment and policy, it will be really important to really focus down on local, resilient, context-specific diets and the supply chains related to that, and how we promote and improve and optimize how those work. It would require, maybe as a second point, a really clear and expanded role for women and young people, especially moving or providing the opportunities for women to play a much stronger role in the value-add sections of the food system, but also for young people to really find opportunity within food systems. For example, because our farming workforce is aging, it's very much rural, but there are opportunities within the food system and agribusiness where young people can be interested. It will require, maybe as a third point, harnessing the strengths of smallholder farming, which is still the big supplier of our food system upstream, but also the strengths and the power of SMEs, small and medium enterprises. Farmers to our SMEs, they provide 75% of the food that we consume. And how we support their survival and sustainability will be really critical. Finally, I wanted to talk about something that we've also been involved in, which is really about the enabling environment. And it's something called the Initiative on Climate Action and Nutrition, or ICAN. And it was launched at COP27 in Sharm el-Sheikh. It's co-chaired by GAIN and the government of Egypt, who were the hosts of COP27. And the point of it really is about connecting existing infrastructures for nutrition and climate decision-making, so that it facilitates much stronger, much more effective joint action that helps us to address or really brings forward outcomes for both nutrition and climate. And it kind of works on a number of different dimensions. There's a decision-making dimension around this, where, we look at how government policies and institutions work. 10 countries are already signed up to this. And, it's about what's the decision-making infrastructure around, and this is where the laws and the policies come together. There's a kind of policy and strategy dimension to this. And it could include things like public procurement. How do we use public procurement, which is a big expenditure item for government, to drive a focus on climate and nutrition? For example, we've talked about homegrown school feeding this morning. There's a capacities dimension, what kind of research and development we need to see in our countries to make that connection much stronger and to really drive outcomes. there's an investment dimension, and that will include how budgets are focused on climate, nutrition, water systems, and all of the interrelated systems that we need to be looking at. But also, there are things like, impact funds and so on, and other forms of investments, and how we benchmark how that is working across different countries. There's an implementation dimension around this. We've heard about the nationally determined contributions that we've signed up to. We also have national nutrition plans that we also set targets for. Within those, for example, just those two public commitments, where are the connections? Which targets are speaking to both climate and nutrition? How do we ensure that our investment is focused on that? And finally, there's a dimension on how these things are reported. We have different channels, IPCC for climate, the Global Nutrition Report for food and nutrition. We need to see more climate indicators reported for food, more food indicators reported for climate, and so on and so forth. So ICANN is really trying to push some of these ideas and working with governments to integrate this at the national level. So there's a lot of work to do, but there's already quite a lot on paper.
Happening.
It's really getting those things.
Oh, thank you so much. Thanks for sharing about ICANN. Is Nigeria one of the 10 countries that have signed up? Is the first question I would ask.
Yes, really. I believe so.
Yay.
I need to make sure of that, but we're pushing it from the outside.
I mean, because we have a Nigeria Climate Change Act that was signed by the president a couple of years ago. But when we looked through the act, we saw that it was very multi-sectoral, had women representatives, youth representatives, had representatives from, of course, the implementing MDA, which is Ministry of Environment. But the Ministry of Health wasn't there. And that was a huge gap that we spotted. And it's one of the reasons we had invited one of the directors from the Ministry of Environment on this panel. Fortunately, he seems to be running late. But knowing that there is already these high-level discussions happening about how you need to integrate climate with nutrition and make sure that both sectors are measuring each other's indicators, it was surprising to find that we had this whole act, one of the first in the African region, and health was conspicuously missing. So that just made me think there's a huge gap in the knowledge of policymakers and even the public of how interconnected and how related these things are. And it made me wonder if there is enough data out there. Are people churning out evidence? And is the evidence informing decision making? Because that's when you that's what you use to benchmark whether your recommendations are being implemented or not.
Yeah. So that's why when I first came up, my first comment was to really share my excitement at John's presentation on climate, because the capacity to even engage with this sector is critical.
Yeah.
And it's about understanding what's going on. We don't have to be experts, but we need to be able to see the connections and to feel comfortable about actually having those conversations and bringing all of this kind of multi-sectoral conversations together. So that's great.
But if Nigeria has signed up to ICANN, then yay.
Yeah.
Progress. So, Chukwuma, what are the gaps you've noticed in the policy environment, and what are your recommendations for bridging those gaps? We've already talked about a few, but you might have some additional thoughts. Okay. Can I just correct my name before we go on? I said I would like to correct my name before we go on. It's Kemi Sola. Only Jane has gotten it right on this panel, which is interesting. No worries at all. Please.
Like the previous speaker mentioned, Nigeria doesn't have a depth of policies. They have a lot of policies across all gamuts of intervention. You can think about AIDS, HIV, nutrition, social protection. We do have those policies, but the problem really is the implementation. And I was equally excited when the director was making his presentation, and he talked about the attempts to mainstream climate change in a policy form going forward. That of course, is one of the obvious gaps, insufficient mainstreaming and integration of climate change considerations into our food security and nutrition policies. So what we have at the moment is inadequate, and it leads to a lot of missed opportunities, when we are looking at that synergistic angle of doing things. So it could be better. So we would be looking forward to the policy that the Ministry of Health is coming up with. One of the gaps we have, having mentioned that there's an issue with implementing policies, obviously one gap is, do the people who are entrusted with implementing these policies have the required capacity to even interpret these policies and put them into actionable steps? So there is a problem of capacity, a very, very big problem. So we have inadequate capacity, both at the human level and institutional level. You still find out that people don't have this understanding to address the complexities of climate change and food security. So if you don't have the capacity, then that would be an obvious challenge in even policy implementation. We've heard a lot about data. We have insufficient data. Even though we have some data, we don't have enough data evidence-based data that would provide us that with the necessary action for policy development and decision making. And the big elephant in the room, inadequate funding. So you can come up with all the policies and come up with all the roadmap, but if there are no funds on the table, then it becomes much more difficult to move. Like I mentioned earlier, the American government, and through its vehicles of implementation, have made significant commitments to addressing climate change. But like Vivian profoundly mentioned in her welcome address, one person can't do it alone. So it has to be a multi-sectoral approach. And it has to go beyond words and commitment. Funding has to be put on the table for things to move. So in terms of recommendations, we've had some of them. There needs to be enhanced policy coordination. We need to mainstream climate change. Policymakers need to integrate climate change considerations into food security and nutrition policies at all levels. In other words, we need to take a holistic approach towards climate change. Like I mentioned earlier, we don't have a dearth of legislations and the appropriate laws, but there's a problem with implementing these laws. So if we can implement some of the laws we have, then we'll be making a headway. We also need to strengthen capacity building. We need to invest in leadership, very, very important. And we also have to improve our data collection apparatuses. Governments and organizations should prioritize collection analysis of data. That is quality data on climate change, on food security, and nutrition information. And we've all said it here, a multi-sectoral approach. All sectors have to be on board. We need a broad range of stakeholders to address the climate change issues, from communities to civil society organizations, and very importantly, research institutions, because that is where the innovations would come out from in addressing the issue of climate change. And lastly, we need sustainable financing. Budgets should be allocated for climate change issues. The programs that are coming from the government end make available budgets, but not just making available the budgets, but also releasing the funds for these things to be implemented.
Thank you so much. I hear you about multi-sectoral collaboration and coordination. The private sector is usually conspicuously missing from these conversations, but we know
Sorry,
how...
I missed that out. Private sector.
Oh, okay. Thank
But
you.
we do a lot of work with private sector.
Yes, I was actually hoping to hear more about that because I know that you and Dr. Michael had spoken about some of your private sector collaborations. Maybe if there's time, you could share some of your thoughts around that as well. But let me come to Jane. Jane, in your experience as chief of section for WASH, chief of the WASH section, how could you share some examples of ways that you have integrated climate resilience into WASH programming and how that has translated to improved nutrition or food security outcomes?
Thank you very much. I want to start by telling you about something called the Children's Climate Risk Index. It's a report that UNICEF developed, I think, last year, looking globally at a multitude of different indicators that imply impact of climate on children. And Nigeria, unfortunately, came joint second worst in this report as one of the highest risk countries in the world for children with climate. And that's not just any sector, but that's a multitude of different sectors. So it really is happening now, and it really is already a big risk to children. And obviously that's going to affect agriculture, it's going to affect water supply, and it's going to affect nutrition. So what UNICEF Nigeria has done in response is developed something called a Climate Landscape Analysis for Children, a CLAC. And this is, again, multi-sectoral, covers all of the areas in which we work to really look at synergistic ways that we can really approach this. And one of the key areas that we found most important is data and evidence. It's surprising. We have a huge amount of data for Nigeria. We have great mixed data. We have the multivariate poverty analysis. But it needs to be re-evaluated, I think, specifically looking at some of these climate risk indicators and bringing those to the fore. And I think from those, we can start to develop indicators that really would help us. Now, I know there's some big funding for climate in this country at the moment, things like the GCF, but most of these projects are infrastructure or they're agriculture. But at least if they could have indicators that were impacting on the nutrition for children, on the water supply for children, it would make a huge amount of difference because we would be then generating more data. I think both of the speakers have mentioned evidence as one of the most important issues, and I think this is one simple way that we could really generate it. Now, WASH, UNICEF have been working towards climate neutral, carbon neutral installations for many years. We are the country in the world that has installed the most solar WASH installations of any country. That's partly due to the size of the country as well, but it's a long-standing tradition to put in solar, and also, if rehabilitating a water system, to convert to solar. And we're now taking that a step further with our new country program to really look at carbon neutral facilities. So by that I mean healthcare facilities that have solar, that runs the water supply, but also runs the cold chain, for example, to make sure that it keeps ticking over, and all of the electricity in schools, for example, to make sure that kids really have access to computers and digital learning and all of those kind of things. So I think there needs to be a bit of a mind shift in terms of really thinking about carbon neutral, about not running the petrol generator but having a solar panel instead, about the ways that we can reduce our use of fossil fuels and shift much more to sun, which we have an abundance of, and it makes so much sense to go solar. So I would say that's one of the first initiatives that we've been really focusing on. And then I think in terms of WASH, I'm very concerned about water, groundwater in this country, particularly because of the lack of legislation about the management of it and the use of it. So at the moment, anybody can drill a borehole anywhere. That means the water is just being pumped out, it's not being managed, we are mining the water. Water is a renewable resource, we have to keep putting it back. And yes, there are heavier rains in some parts of the country, but other parts of the country, there are increasing droughts and the water tables are dropping, for example, in the northeast at alarming rates. We are really mining water supply and it is not sustainable. So I think looking at legislation for groundwater regulation is incredibly important, but also because of land degradation, for example, chopping down so many trees, it means that there is there's more runoff and there's less filtration into the ground. So we're actually shooting ourselves in the foot in terms of water filtration. Less is coming into the ground, as well as there are more people, as has been mentioned, and there's more use. So it's going to really hit us soon that water resources aren't infinite. They are most definitely finite. And this is really going to be a problem for the country unless we address these issues. So I would say UNICEF is really looking to support the kind of policy and legislation that would help to improve that situation. But also in terms of land degradation, as has already been mentioned, we really need to look at more sustainable land use practices to make sure that runoff is reduced, that flooding, which is inevitably going to increase, is managed and it's prepared for, so that it's not a shock every year, because it's going to happen every year, and it's what we call a chronic emergency rather than a rapid onset surprise. It's something we know is going to happen. We need to get ready for it and be prepared. So those are just some of the areas that UNICEF's working in. Thank you very much.
Thank you so much. Thank you for sharing. Those were very insightful. So very quickly, I'm going to take only 2 questions, exactly 2, and you will have exactly 1 minute to share your thoughts. Questions, comments, or feedback. If there's no one, I'm not sure if that would be a good or a bad thing. Does anyone want to say something? Okay, so, last minute. Okay, can we get a mic to Rachel, please? Rachel, please signify they're looking for you. Yeah.
Good morning, all. Thank you very much for your well-informed thoughts. With Dr. Mike, please, I would like to know if your program include promoting the consumption of locally available climate-resilient food to Nigerians. Thank you.
Okay. Vivian?
Okay, thank you all so much for a lot of the insights you've shared. I think, listening to all of you, I think there's a lot we've learned. And having you on this panel, Jane, there's a lot of insights that you shared, especially in their intersection of WASH, which we underestimate. I think when you mentioned about the drilling of boreholes, I think everybody in this room probably has a borehole.
Yeah.
But how many of us actually think about the long-term impacts on it? So these things seem obvious, but actually they're not. But thank you for sharing that. I think for me, what struck me listening to a lot of the discussions is, even when we were organizing this policy dialogue, is the need to mainstream climate change. It's just not, we just don't sense it seen as an existential problem in Nigeria. And also the real gap in capacity across the different ministries and the need for a mind shift. So, for us, we're here in Abuja having these discussions. So maybe this question is for both you, Michael, and Dr. Jane. At the subnational level, where really the dirt hits the road, there will be a lot of work that needs to be done, because these are where the weaknesses in capacity, etc. So both from GAIN and so UNICEF, how are you working in that area to build that subnational capacity and understanding about the existential problem of climate change, but also impact on nutrition? Thank you.
Okay, who wants to go first? Jane?
Thank you so much for the question, Vivian. I think it has to be a multifaceted approach. And I would say that we need to start from the bottom up. I mean, one thing, for example, when UNICEF sets up a new water system, there's a lot of consultation with the community, and we always do something called water safety planning, which is discussing with the community about keeping the site environmentally clean, but also about recharge and about some of these climate issues that's talking. And I think if people are made more aware of the issues and of their rights, because some of our surveys suggest that people aren't very aware about it. It's not something that's discussed much in Nigeria. If your average rural householder, for example, is knowing about the issues of climate change, they're seeing the impact on their crops, they're seeing the flooding, they're seeing the drought. If they know that there is a way that they can mitigate for these things, I think they will not only work towards that, but demand from their government that more is done about it. And then I think obviously there's the need for sensitizing local governments about some of these issues in all aspects. And you're absolutely right, it has to be completely cross-sectoral because they're so interlinked, all of these issues. So I would say it's not so much investment as advocacy, a lot of it. And a lot of it, I mean, shifts like to solar should really be government policy, and it should be made cheaper, more accessible, and there should be no excuse. There could be laws about it, and there certainly could be tax breaks for it to make it more attractive for people to shift. So just some of the ideas about things that we could do. But I think you're absolutely right, and it does remind me of the early days of gender programming, when should we mainstream, should we have a separate section, and I think we've gone back from mainstreaming now to having a separate section for gender, because the fear of mainstreaming is that, oh yeah, that's covered. You know, nobody does it because it's been mainstreamed, haha. So I think I would warn against mainstreaming, but we definitely need to be talking about climate and considering climate in absolutely everything that we do. Thank you.
Thank you, Michael.
Okay, thank you very much for those questions. So maybe for the first one, I mean, I could just say, yes, we are. But I'm sure you wanted to hear a little bit more than that. And I think it's really critical that we as a country really think about what we're consuming and why, and then let that drive work that we do both top down and bottom up. We've been supporting the government on understanding, you know, if you like, what people are eating. Over the past 2.5, maybe 3 years, actually, we've been supporting the government's conduct of a national food consumption and micronutrient intake survey, which reported preliminary results late last year. We'll report finally this year. Some of the work on the food-based dietary guidelines that I talked about will help us to understand local foods and what dietary impacts they have or can have on people's diets. All of those things then really help us to begin to engage with people about transitions they need to make in their diets. So there's all of that kind of work that's going on, but while that is happening, we have to be doing other things, like working with state governments, local governments, and communities to really meet them where they are. People eat maize, they eat cassava, they eat millet, rice, and other things. And so before we shift their diets, can we make what they currently consume more nutritious? Can we encourage them to really think about local alternatives that are available? I mean, rice is an interesting one because over the past few years, sorry, how long have I got?
1 minute.
1 minute. Over the past few years, we've seen rice rise from something that used to be consumed on Sundays or occasions to something that people eat every day. And the consumption, the per capita consumption of rice has gone like this. It's nearly at the same level, or it's coming close to maize. It used to be way below other staples like yam and cassava and potato and so on. And the reason for that is because it's seen as aspirational, I suspect, and so on. But it's displacing the kind of staples that people would normally consume in their local areas, and that could be different for different parts. In the north, it could be maize and millet. In the south, it's more yam and, cassava and sweet potato and so on and so forth. And it's really bringing people back to that, to say, look, let's really focus on what you can get locally. Then how do we improve the nutritional quality of those staples? And that's what informed our work on biofortification. A lot of research had been done by organizations like IITA and ICRISAT. They'd established the scientific efficacy of these crops and delivering nutrients, but it hadn't been commercialized. So our role was to bring our commercialization capabilities to those crops and really, help to make them secure larger market share. So yes, we are really focused on not just some of those staples, but there are even things that we refer to as underutilized indigenous crops or underutilized nutritious species that people have moved away from completely just because, the demand creation isn't there or the marketing is focused on other food products. And we, in the National Food Systems Pathways that we agreed as a country 2 years ago, we're working with the government on, that is a big area of focus that we encourage both the national government, state governments, and so on to reinvest and really begin to build demand for some of this food. So there's a lot of work that is happening. There's more that can and should happen. In the 30 seconds I've got left, on the question from Vivian, I think the way that I interpreted that really was, we have a big capacity issue at the national level. What is it like at the state level and the local level? And it's a big problem, right? But we have to keep working with the officials who have the duty and the responsibility to build capacity, to increase understanding, to encourage, this cross-sector working. And some of that is, I guess, will be helped by, or is being helped by the experiences of people every day, Climate change, like you say, is already an existential issue for many of us. People have had to move from communities because, of the impact of climate change. People have seen incomes go down, they've seen crop yields go down. And so having those conversations based on their lived experiences can help. But what we do to support them needs the capacity for the local, state, national policymakers to be able to think about these things and to draw in all of the help that's available. And that would be with funding from, international partners, with support from technical partners like ourselves, to really begin to find solutions. So it's a lot of stuff on paper. It's now about moving that into implementation, but the capacity issue, especially at the subnational level, where a lot of the work, where a lot of the action is really a big problem, but we have to crack it.
Thank you. Thank you so much for sharing. Thank you for this excellent panel. Our calls to action are clear. We've spoken about the need for capacity, which is where Dr. Michael just left off of, and the need for leadership and governance, legislation, both around the use of fossil fuels, the sinking of boreholes. We heard about the need for the government, for example, to take on costs or reduce costs for solar or alternative energy for consumption. We also heard about the need to empower women and youth. Women actually account for over 70% of the agricultural workforce, and yet there is, a lot of empowering that needs to happen there. And, I was on a radio show yesterday to talk about this event and the need to integrate climate change with nutrition and food systems. And someone just said, what about the young people who would rather not go into agriculture these days? And they frown at those kinds of work that you have to use your hands to do. And we do have to plant a whole lot more because, like we said, we would probably be over 400 million strong by 2030 or 2050? 2030.
I hear by 2050.
2050. So we'll be the third most populous country in the world very, very soon. So I think one thing I will take away from this panel is the need for sensitization to create awareness. Fun fact, this is the least attended event Nigeria Health Watch has ever organized. Okay, maybe not ever because I'm not that old in Nigeria Health Watch, but you know what I mean. And you find that climate change just isn't a buzzword in Nigeria, unfortunately. It doesn't generate a lot of interest, right? But it is so important. And Vivian has spoken about mainstreaming climate change. I think I would also like to flag that from this panel. We need to have more conversations like this. We need to bring all of the stakeholders. We found how far-reaching the multiple sectors are. We had someone from WASH speak, and we heard how interconnected it is with climate change and with nutrition and food systems. So this has been a very rich panel. We've learned so much. The calls to action are right there for us to take up and ensure that they are implemented. So thank you so much to my panelists. Please put your hands together for them. Thank you for sharing your thoughts. Thank you very much. Can we take a group picture, please? Vivian, Dr. John?
Thank you so much, Kemi. Thank you, everyone. And yes, you are right. This is the least attended event Nigeria Health Watch has ever organized. And I do agree that we must have conversations like this a lot more often. Now, when I was a child, at some point, I had my red blood cell levels were quite low. And the doctor advised my mother to feed me more vegetables. Now, I absolutely hated vegetables. And so every time she gave me, I would feed it to the dog. But I kept getting caught. Now, I didn't know that the dog also did not like vegetables and he wasn't eating them. And so needless to say, my mother found very innovative ways of making sure I ate them. I think I remember one of her innovative ways was her standing over me with a slipper in hand, making sure I ate every piece of vegetable on my plate. And now, I'd like to call on Onye Dikachi Ewe, Senior Program and Advocacy Manager at Nigeria Health Watch, to moderate the panel on showcasing innovations in climate-resilient food systems for better nutrition outcomes. Please help me welcome her.
Thank you, Betsy. Yes, very quickly, we'll just move on to the second panel session for this nutrition policy dialogue today. I would welcome our esteemed panelists who will delve into the various ways their organizations, their efforts are channeled towards innovations in climate-resilient food systems for better nutrition outcomes. Please welcome Mr. Michael Daniel Eveshonya. Yes, this is a good place to clap. You're welcome. He's the technical advisor for USAID Advancing Nutrition Project implemented by Helen Keller International. He has over 12 years experience in humanitarian and development sector, and he specializes in areas such as food security, livelihoods, food systems, agricultural value chains, cash-based transfers, and nutrition. Throughout his career, Mr. Eveshonya has held strategic positions in national and international organizations, including Deputy Head of Department for Food Security and Livelihoods at Action Against Hunger, Senior Program Coordinator for Food Security, Sustainable Livelihoods, and Resilience at Christian Aid, and Program Manager for Agriculture and Livelihoods at Feed the Future Nigeria Livelihoods Project. You're welcome, Mr. Michael. The second panelist I'll welcome is Hope Ikani. Please, Hope Ikani, a round of applause as she makes her way up stage. Hope Ikani is Program Officer at Civil Society Scaling Up Nutrition in Nigeria. She's a biochemist with 5 years of experience in nutrition advocacy, program planning, and implementation of donor-funded initiatives aimed at achieving food security. With a strong passion for nutrition, food systems, advocacy, and agro-business, Hope has demonstrated her expertise across diverse sectors by effectively coordinating and supporting projects aligned with her interests. She has also been instrumental in conducting capacity building programs for CSOs, CBOs, while adeptly managing relationships with stakeholders at various levels. You're welcome, Hope Ikani. The next person I'll invite to this panel session is the Senior Technical Nutrition Advisor at Alive and Thrive FHI 360. Please join me to welcome Dr. James Oloyede with a resounding applause. Thank you, Dr. James. Dr. James has over 30 years experience in healthcare and nutrition sectors. He has made significant contributions as a nutrition and public health professional. Dr. Oloyede served as a pioneer retired Director of Nutrition in Osun State and successfully managed a Bill and Melinda Gates Foundation grant on engaging nutrition academia in Nigeria. Dr. Oyolede's expertise is evident in his contributions to numerous nutrition policies, guidelines, and strategies. He holds multiple degrees, including a BSc First Class in Human Nutrition and a PhD in Public Health. Additionally, he is a fellow of the Nutrition Society of Nigeria and the Institute of Corporate Administration of Nigeria and a registered member of the Environmental Health Registration Council of Nigeria. Dr. Oyolede has authored books and research articles further demonstrating his commitment to advancing the field of nutrition. Thank you very much for honoring this invitation. The final on this panel I would welcome, and certainly not the least, is the Deputy Director, Divisional Head, Federal Department of Agricultural Land and Climate Change Management Services. Please, with a round of applause, let's make welcome Dr. Michael Adeboye. Dr. Michael Adegboye joined the Federal Ministry of Agriculture in 1992 as a land resources officer and has served meritoriously in different sectors of agriculture and climate change, including lecturing. Dr. Adegboye has published a book and 30 journals and proceedings on various subject matters. He attended the University of Ibadan, where he obtained a BSc and MSc in agric extension, crop production, and he is an esteemed panelist on showcasing innovations in climate resilient food systems for better nutrition outcomes. Thank you. All right. So to take this discussion forward, my first question will go to Dr. Michael. I have two Dr. Michaels on this panel. So the first, Dr. Michael. Okay, Dr. Michael, I'll refer to Dr. Eveshonya and Dr. Adegboye. Yeah, I hope that works. Thank you. So Helen, Keller has a goal, a mandate to you have this holistic approach in implementing nutrition programs in Nigeria. Can you tell us about your multisectoral engagement, especially the community interventions and the various ways you're conducting your implementation?
All right. Thank you so much for that. And I will give us just in a few seconds briefly of what we do in Helen Keller. So our mandate majorly focuses on nutrition, as well as saving sites and treating neglected tropical diseases. And we do all this through our multi-sectoral approach. So streaming down to core nutrition interventions, we also do both nutrition sensitive as well as nutrition specific intervention. So for our nutrition specific interventions, we focus more on administration of vitamin A supplementation, as well as training of health workers, and also building capacity of nutrition focal persons. Then for the nutrition sensitive, we do that through improved practices on agriculture, as well as provision of improved biofortified food crops to community members to produce in their farms and also use them at household level. So our implementation strategy focuses more on working with all stakeholders that are involved in nutrition and preventing malnutrition. And we do this through the full system approach, where we don't just focus on production, but we also focus on both sources of inputs, as well as supporting the production itself and post-production activity. So first, what we do is to identify relevant key stakeholders to design the project together. And I want to also let us know that our project is community-based driven. We don't implement project because we have the funding, but rather we implement project because it is the need on the ground. So to do that, we do what we call community-based participatory planning, where we discuss with the communities and we co-identify the available challenges and the available resources to solve the challenge. Sometimes you know that the community will come up with a lot of wish lists, which may not fall into the small budget we have. So we have to stream down to ensure that the wish list become a reality. And in that regard, we also prioritize the activities that we can fund using the available resources. So having worked with the community and we co-identify the challenge and co-create the solution, then the beneficiaries are also jointly identified together. So we don't just go to community and identify Mr. ABC, but rather we work with the community to co-identify the beneficiaries for the intervention. Then we know that capacity is a major issue, which many of the other panelists have spoken about. So we try to build the capacity of the community people, not just the community, but also government stakeholders who are very relevant. You know, a project will come and go, but the government people remain because they have at least 35 years in service or, you know, before they retire. So we build the capacity of the government people to ensure that they, on their own, can drive the process even when we eventually exit the community. So when that is done, then the implementation proper. So for our implementation, we try as much as possible to also support the usage of biofortified food groups, just like Dr. Michael Ojo mentioned. Because most of what we consume today, some of them actually lack some micronutrients. As a result of those challenges, a lot of research institutes, like you mentioned, like ICRISAT, like IITA, have worked on improving the micronutrients components of those food. So we work with those groups to have access to the biofortified food. And we don't do this alone, but we do it through private sector drive, where we engage the private sector to go to the community, advertise or let people know much about these food groups, and then the people continue to have direct access to the dealers of these biofortified seed groups. And we also train them on how to plant, how to manage the farm, till post-harvest and post-harvest activity. And in doing this, we're talking about climate. In doing this, we deliberately include climate issues in all our training. I was just talking to my brother here that for me, I think we should not be using the word mainstreaming again. It should be inclusion. If we are saying we are mainstreaming climate, somebody will say, okay, let's put it small. And that small is nothing. So when we are designing our program, it should be deliberate inclusion into the design of the project. And that's what we do. So at every level, we try to include climate issues, and these issues are discussed, even at the community level. So our beneficiary knows what they should not do because it affects the climate negatively. Then, when the crops, for example, when the crops are matured and they are harvested, we train also our community people on post-harvest handling, because researchers have shown that almost 40% of our harvests actually get spoiled at the point of harvest because of gluts at that particular time. So we train them on improved method of storage. And not just improved method of storage, but how to include safety in their storage. I'm sure all of us were also aware of a particular period where we have what we call the killer beans. In that regard, there's an improved method of storing cowpea without adding any chemical to it. For example, use the pigs bags. So in our project, pigs bags is one of the innovations that we promote for storing cowpea, for storing all grains. And please, all of us, when you get home, get a pigs bags, buy your cowpea and store them. Don't use any chemical. And when you use pigs bags, for example, you don't need to bother. The weevils cannot walk in there because it's an hermetic bag and it's airtight. So anything that is live in there gets, does not survive it. So apart from that, we also train them on cooking demonstrations. Somebody asked a question if, for example, we are promoting locally available food groups. Yes, for us, we also train them on cooking demonstration. Somebody will ask, why are we training people on cooking demonstration when our mothers, our sisters have been cooking? But you and I know that sometimes the combination of these food groups, many people don't have the knowledge. And it's not just food we are talking about, but we are talking about nutrition. So if we're talking about nutrition, people need to know how to combine the food groups available to them in the right proportion, and even in the cooking period, not to denature some of the micronutrients. So we also train people on cooking demonstration, and we have recipe books that are validated by the federal government that are also produced and hand over to the community members. Then we know that malnutrition, for example, is not just in food. We also talk about the hidden hunger, which is sometimes lack of certain micronutrients in what we eat. So, and that is where the vitamin A supplementation comes in. So every year, the twice period during the MNCH week, we ensure that every child that is within the age of receiving vitamin A supplementation, across all our projects implementation, vitamin A is they are supplemented with vitamin A. And we also do general SBCs to include WASH, social behavioral change communication, as well as WASH infrastructure. Even we are not doing very hard WASH, we may not be sinking borehole, but we repair already existing boreholes, and we also change people's concept towards how they handle issues that has to do with hygiene. So this is also part of what we include in our programming, because nutrition, food alone, as I said, is not nutrition. Then we do mass screening and refer children who are falling into SAM to relevant centers where they can get care. So all these are the multi-sectorial or integrated approach that we are using in our programming. So for every community, they receive each of these services at one time or the other. So for us, again, we also build the capacity of health workers and agric extension agents. I'm happy that my elder brother and his supervisor from the Ministry of Agric is here. So we train agric extension workers on some of these improved practices for what they need to step down to the farmers. But again, I'm sure all of us know the challenges involved in that. Maybe when we get to the other side, we can talk about it. So these are the things we do in terms of our programming in the face of climate change and our innovations that we're using to improve nutrition outcome. Like Dr. Joe mentioned, Helen Keller is one of those that are also supporting the food systems dashboard across the sub-nationals. So the essence of the food system dashboard is that everybody can go to the dashboard and get information on food system, food environment, food markets, and all of that. And when this information are readily available, even the producers will know when to produce, they will know where the market is, they will know who needs what they have produced. And in that regard, it becomes very easy for them to channel their efforts towards where the gap is, and to also moderate what they produce to ensure that at harvest, there is no too many losses, on the farm. So for us, this is exactly what we are doing. And maybe just to add to it, I also do train people on how to make this Tom Brown. I'm sure many of us may have heard of what is called Tom Brown. Tom Brown is the combination of different foodstuff. Yeah. Say it again? Yeah, different series, and not just series, different series and legumes to come up with a very healthy pap-like food that children actually eat, and it helps to improve their nutrition. So this is exactly what we do in Helen Keller across our projects location. We currently implement in 12 states of Nigeria. Thank you.
Thank you. It's interesting to listen to the holistic approach that Helen Keller is employing to tackle nutrition, and also the fact that you're integrating climate actions, because climate change is here, is an existential problem, and whether we discuss it or not, it's here, and it's something that we have to begin to provide proactive solutions towards tackling it. It's displacing people all over the globe, and even in Nigeria, people get displaced every year due to climate change. So it's something that is a threat to our food security, and we know that nutrition is a critical part of health and development. People who have better nutrition are more productive, and if we want to tackle zero hunger sustainable development goal, then we have to look critically at how to tackle and integrate climate change and nutrition. So thank you very much, and I would say well done to Helen Keller and all the initiatives that you're putting out there. And also the pig bags Yes, maybe after now, you tell us how we can access it if we have more time. I'll still come back to the learnings. I know you've touched a bit on your program design and implementation. We'll still talk about the policy environment and how you are implementing with the enabling environment available. So I'll move to Hope. Yes. Your organization implements programs to accelerate the progress on nutrition for women and girls, and also you support the federal government to develop performance management systems for improved nutrition coordination. So please tell us, how is CSSON, or the civil society, scaling up nutrition in Nigeria? How highlight those human-centered approaches your team employs to solve this climate change aggravated malnutrition in Nigeria?
Hello, can you hear me? Yes. Okay, good afternoon once again, and thank you for this opportunity. Civil society scaling up nutrition, one of our key strengths is mobilizing. Sorry, I can't hear you. One of our key strengths is mobilizing state actors and non-state actors, We generate evidence and, build capacity of communities. And so we recognize that in addressing climate change, aggravated malnutrition, one of the things we consider is the needs. And we also consider the perspective, and we also put into cognizance the experience of individuals and communities that we're working in. And one of the things we try to do is make our programs people-centered. We make our programs people-centered so that our programs are tailored to their specific needs, to the specific needs of people that have challenges of climate change and are vulnerable in their communities. One other thing we do this by involving relevant stakeholders. We engage them, we empower them, relevant stakeholders such as civil society organizations, community leaders. We empower them and we involve them in the planning process, in our implementation process, even our design process, we involve them. And so this participatory approach helps them to take ownership of this project. And one other thing we also do is that we build their capacities. Dr. Mike was just saying, we just came back from one program we supported, Advancing Nutrition for, and that was building capacities of CSOs and CBOs. So that's one thing we do strongly again. We build capacities on various different aspects, nutrition programming, grant writing. And so what this helps them do is that it gives them ownership. It puts them in the light of, okay, when this intervention is done and gone, we can still carry on with this. Another thing we do strongly is advocacy, and we advocate for solutions to micronutrient deficiencies. And there is a link between climate change and maternal health, anemia to be specific. I'll use a case study of Bauchi State. So Bauchi State is in northern Nigeria, and you can see that from all indications, they suffer climate change. Climate change affects them. So they have unpredictable rainfall, they have long drought period, they have high increase in temperature. And so these things affect their agriculture, it affects their food production, and overall, generally their nutrition in general, okay? So these things are, and again, according to NNHS 2018, they said they had like 68.6% of anemic women. So you can see the linkage between this climate change and nutrition for women, the vulnerable group, in an already vulnerable situation. And so We try to advocate for the use of MMS, that's multiple micronutrient supplement. You know, right now we're trying to move from IFA, and we're moving to the recommended MMS by the World Health Organization, and we're trying to advocate for all of this, put it so that more people will be aware of this and these communities that are affected by it. So thank you. That's it.
All right, thank you. IFA, you said you're moving from IFA to MMS. Yeah. IFA stands for?
Iron folic acid.
Oh, great. Thank you. So it's good we established that. Okay. Thank you very much, Hope Ikani. So I'll move over to Dr. James. Dr. James has ample experience and a length of time in nutrition practices. And now you are with Alive and Thrive, and you work with governments and other development partners to develop and deliver solutions to nutrition challenges and provide strategic technical assistance, and also conduct nutrition research to generate data-driven insights. And of course, with data, you definitely come up with informed decisions and solutions. So please share with us some of these innovations Alive and Thrive is deploying in improving nutrition outcomes despite the climate change challenges.
Thank you very much, moderator. Good afternoon. Let me commend the former speakers, the panel. For us in Alive and Thrive, we are well noted with 4 major competencies. One is in advocacy and policy. The second one is in the issue of social collaborative communication. The third one is strategic use of data. And the fourth one is interpersonal communication and social mobilization. These are the areas where we work. And our current intervention or program in Nigeria has to do with accelerating the scale of maternal, infant, and young child nutrition intervention in Nigeria. Yes, we want to salute our colleagues in food and agricultural sectors who are producing food, because without food there can be no nutrition. That is very basic. There must be food. Now, what do we do? Climate change is already here with us. Human activity and nature has conspired against us. Then we have to live, with the climate change and find a way around it. How do we maximize the food that are available to deliver improved nutrition outcome? That is what we do, especially in the area of maternal, infant, and young child feeding, with the scope of intervention in Nigeria. And let me say this way, what we do are divided into two, even though they're one at the federal level and at the states. Currently, we intervene in 7 states of Nigeria: Lagos, Sokoto, Kano, Bauchi, Kaduna, Yobe, Borno, Lagos 7, in all where we intervene. But at national level, we are supporting the government of Nigeria to put a Ministry of Health, because we work within the health system. In our own case, we work within the health system. And what we believe as a philosophy is that in addressing this issue of nutritional outcome in the face of climate change, we need to use system approach. If we don't use system approach, we will not be able to deliver improved nutritional outcome. How do we do this? At the federal level, we believe that when we talk about climate change, the documents, the guidelines, the policies, the strategies must have the components of climate change for us to be able to use it to achieve improved nutrition outcome. So we are key partner with the Federal Ministry of Health in reviewing the maternal and young child nutrition policy in Nigeria, the guidelines and the structure that guiding its operation. We are part of people that also support the review of Nigerian multi-sectoral plan of action, right, which also has a component of climate change. Because when you look at the food approvals section of that plan, we discover that most of the food that have been clamoring for the one that are climate are resistant and technological driven. So we ensure that there is, first of all, a policy environment, the guidelines, and of course, the strategy that can drive improvement in the face of climate change that we find ourselves, not only in Nigeria, but globally, as well. Then apart from that also, specifically, some innovation that we are implementing currently include the development of what we call workplace breastfeeding toolkit. Alive and Tribe was one of the key partners that developed baby-friendly initiative in Nigeria, the Keller, that was launched last year. And we're also in the vanguard of advocacy to increase the maternity leave to 6 months. And why are we doing that? We are doing that because we know that what breast milk substitute does to the environment, contribute to our climate change, is not small. For instance, let me cite an instance. In Nigeria, assuming that 200 million people, in quotes, and 8% of that 200 million are children under 2 years old. That would give us around maybe 160 million. Of that 160 million, around 2% are fed with BMS. So that is a substantial number of lives. We're going to have around 4 million or thereabouts. Okay, to feed, according to some studies, to feed 1 million children with BMS, you will need about 150 million cans of BMS, right, within that period. Imagine the quantum of waste. The BMS can will end up in sandfield. The paper bag, if they are rubber or plastics, will end up in ocean, in river, either blocking a draining pipe or constitute some other, bringing about flood and some other things like that. So that's the reason why we focus in promoting exclusive and breastfeeding. And we discovered that yes, government is doing its best, but how do we carry along the private sector? So we start the innovation to work with NECA, okay, and the new subgroup of NECA to pilot 2 crèches in Lagos, where we launched this workplace breastfeeding toolkit. We started one in Lasut, we started one in NECA office itself, and after the advocacy, 3 more crèches were established by private sector. Now they are beginning to see it as a business, all right? Seeing it as a business, establish a crèche around their workplaces. We haven't encouraged 2 or 3 companies that are very close to have one. Why are we doing this? We believe that we can promote exclusive breastfeeding and make appropriate breastfeeding. We will reduce the number of children who are being fed on BMS, one. Then we also become environment friendly, because we will not have a large ton of waste to dispose. And don't forget, because that's part of our strength. We are the vanguard of the launch of Zero Water campaign in Nigeria, right at one point or the other, telling mother that a child does not need water until the child is 6 months old. And why? Because breastfeeding saves water, saves a lot of water. You see, quite a number of studies have proved that to get 1 gallon of milk from a cow, you need 144 gallons of water. Whereas for a breastfeeding mother, you need between 8 and 10 glasses of water, on a daily basis. We can say we conserve the environment by promoting exclusive breastfeeding, in Nigeria. That's not just the benefit we have by promoting. I'm just highlighting that as part of a contribution to response to climate change that we have, so that at least whatever is available we can conserve rather than continue to damage. Yeah, apart from that also, at national, there are so many other things we do. We are partners in the food-based agriculture Ghana, which most of the speakers have spoken about. We are co-chair of micronutrient partner forum. You heard when the director of micronutrient was speaking that one of the major effects on climate change is on the micronutrient component of the food, which include iron and zinc, and of course the protein also is affected. So what do? We are there to support and advocate for large-scale fortification of some of the staples, like beans, fortification of beans, and some other things like that. So we are a partner in doing that. Then again, like we said, we have a strength in strategic use of data. So we partner with the Federal Ministry of Health in the development of the Nutritional Commodity Logistic Management Information System. This to promote accountability and availability and supply to ensure that there's no breakdown in the supply chain. And of course, people can go to the dashboard and look at those commodities where they are positioned, whether stock out and the rest like that. Then again, part of what we do is that we support the government of Nigeria through a Federal Ministry of Health to develop, review the national social behavioral change communication. In fact, the subcommittee at national level was chaired by Live and Thrive, because we have a very strong competence in that area as well. And we believe also apart from that, again, on the issue of data, we have at one time or the other supported the FMOH on the inclusion of some of the mycin indicators, which have not been captured in the national health data to be included. Because I believe that food system has to be driven by data. And of course, in response to climate change, we need data from time to time so that we know how to mitigate the effect and know what to do, at the end of the day. Yes, again, recently, we are looking at how can we make our food respond better and improve nutritional outcome for our populace. Just my colleagues by my left hand, we are together in a meeting the past 2 days trying to do nutrition profiling system, trying to promote front labeling on the processed food. A system where we can grade the food, whether by whatever means we want to grade it. So that once you see that food, you know which grade it belongs to and what it contains without having to read all the nutrient details. Because I doubt whether all of us, when we buy things in mall, we go through the labeling to read one by one all that are contained in that food. But what we are trying to do is that, okay, in addition to that, can we devise a means by which mere citing that food, this food is healthy, this food is not healthy, and use that to classify even the company who are making it, and we can even go down to the local and grade the restaurants, based on the diet that they are producing, whether it is good, whether it's a healthy diet or not healthy diet. So we are part of the partners who are working on this. Now, let me go to the state level a little bit. At the state level, what to do mostly is that in each of the 7 states we work, we have our state team lead. We are there. We do not implement directly like some of our partners, all right? What we do is to support the government of that state to strengthen the delivery platform for most of the commodity which my partner have been talking about, either vitamin A or whatever. So we are more or less involved in system strengthening at the state level. And how do we do this? We do gap analysis, because a lot of us have been talking about capacity building. Yet the capacity of the health worker, frontline worker to be built on so many areas. But we do a gap analysis and see actually, is it lack of knowledge or lack of skill or lack of job aid or lack of SOP that is the problem that does not allow our nutritional outcome to improve the way we want it. And we come up with an innovation and develop a practical skill handbook for frontline health worker. Having noted areas where we know there's a deficit skill gap, all right, and train them. In all our 7 states, they have just gone through the training using a practical skill handbook on mycin, okay, all right, as a way to promote dietary diversity, to also promote maternal nutrition counseling during a pregnancy, to also, we discovered that over time in Nigeria, because I come from health system, yet when pregnant mother come to that facility, they take the weight, but nobody uses the weight for anything. It's not being tracked. It's not being monitored. So what we are doing in our project is to devise pregnant weight gain and monitoring charts in our states, so that health worker can use the outcome of that weight to do nutrition counseling, for the woman when it comes for ANC, in the place. We believe with that we will reduce the risk of low birth weight, and the rest like that.
Okay.
Then finally, at the state level, we want to go to the community. So we subcontract, we have some sub-grantee community-based organization that carry out community level nutrition, which include the promotion of homestead gardening and rearing of small livestock. And while doing that, we discovered that the food waste itself constitutes a lot to the greenhouse gas emission. And if the waste are fed to the small animal, that will reduce. The wastewater are used to do homestead gardening instead of constituting another waste around and emitting methane that can cause more damage to our environment. These are many more what we do in our Life and Thrive, to respond to climate change in the area of nutrition and improve nutrition outcome.
Thank you so much. Thank you. So insightful, and it's interesting to note the linkage between exclusive breastfeeding and conservation of the environment. And it's interesting to also know your organization is pushing the agenda for 6 months maternity leave. All intending parents in favor of that, say aye. Oh, it's a large house. Interesting. Very interesting. No, I said intending parents, which includes the women and the men, yes. The tins of plastic that will be consumed and disposed into the environment and all of that. So really, a lot of innovations coming from Alive and Thrive. And this will take me now to the next panelist, the question for the next panelist. I have been informed I have 10 minutes for this session. And so we would quickly wrap up our thoughts. But this is the first time we would be hearing from the Director of Agricultural and Land and Climate, Dr. Michael Adegwe. I just want to know, what are those novel approaches or technologies that have demonstrated promising results in building climate-resilient food systems, speaking from the angle of the Federal Ministry of Agricultural Land and Climate Change?
Thank you, the moderator. Everyone will bear with me that things we have been discussing so far come together on food. And it has been a thing of concern for the Federal Ministry of Agriculture and Rural Development to be facing the issue of climate, because it is affecting our major mandate a lot. And that is the making sure there is food security in the country. And when in the last panel group, one of the panelists, I think Jane, mentioned that Nigeria was the second among the countries being hit most. Yes, it is true, because when the issue of climate change started, when I started in the sense that when people started noticing it, Nigeria was not counting it serious. And the support that's supposed to be given then, especially to food production, was not given. Thank God we have understood now, and just about 10 years ago, Federal Department of Agriculture Extension started, you can see, just about 10 years ago. And some of the things we have done so far is to empower some of the departments. One of such departments is where I belong, Agricultural Land and Climate Change Management Services. We have done some things like coming up with helping the farmers in getting earth dam just to increase irrigation system. You bear with me that issue of water has been affected as a result of climate change, and both animal and crop production has been affected badly. So we have a mandate to give, also supply rather, at dam, not for the drinking like the one the Ministry of Water Resources is given, but to take care of the crop irrigation and animal drinking mostly. And not only that, we have been training people on the agroforestry, which is the major need for us now, because it has been discovered that about 660, maybe 62 million hectares of land in the world has been deforested, at least even every year in the world. And that is causing a lot of damage. So training people on agroforestry is what has been going on. And in 2020, about 10 states in the country enjoy this one with Ministry of Agri in collaboration with Environment to create the pilot studies and the support for the farmers to train them in their own areas. So they were not invited to come to Abuja and see it. The project was given to them there. Not only that, we have some other things that have been done, like issue of trying to encourage the use of alternative fuel for cooking in the rural area, instead of cutting the trees and making firewood. Though it has been so difficult, and it's still difficult now because of our economic situation. Everybody can bear with me, the cost of cooking gas, the cost of kerosene, if anybody could still afford kerosene. I think the last time I priced kerosene, a liter was 860 naira, just a liter. So even costlier than the petrol as of now that the subsidy has been removed. So we have seen some technologies that are already working for us, and we have even development of there's a body called they organize it, the clean cooking. They have developed in collaboration with the Ministry of Technology. They have developed economic stove to use, and this involves using of what we call briquettes. So to reduce cutting down of trees. What do they use to produce briquettes? Most of the waste materials like paper, leaves, and even some cartons of, maybe you purchase something, the cartons can be used and so on and so forth to produce the briquettes, which can be used in the provision of energy for cooking, and more of such are being used to ensure there is a resilience of the impact of climate change presently. And we have other areas, like we have a department of input supply that are now promoting the use of organic source of nutrients to the soil, because inorganic fertilizer is damaging the soil in collaboration with the environmental problem we are facing there. So they are promoting it now. In fact, it was, we are trying to finalize the review of the fertilizer. We thought it would be signed before the minister left, but it has not been finalized. To review the fertilizer policy for Nigeria now. That's the second production. And it includes the production, distribution, and the use, because many of the fertilizers being used introduce poison to the soil, adding to the problem of climate change. And we have all the research institutes under the Ministry of Agric with the mandate of making sure they produce crops, animals that will have resistance to this climate change impact. Especially, they are encouraged to produce short-term crops. That is, the crops that will mature early before the system of rainfall has changed. When they will be expecting about 5-6 months of rainfall, it might have reduced to 3 on some places too. So the aridity has been dropped down from the corn north down to the middle belt and down to the south now. So things are becoming so difficult. But I assure us, not long a time from now, we will definitely move from that number 2. So we will be talking of maybe number 10 or even, I assure you there will be improvement very soon. Thank you, the moderator.
Thank you.
Yeah.
Thank you, Dr. Michael. So before I let you go, I know you have touched a bit on the innovations, the technological approaches that the Ministry of Agricultural, your ministry, pardon?
Ministry of Agric and Rural Development.
Federal Ministry of Agric and Rural Development,
yes,
is undertaking to combat climate change and ensure resilient food systems.
Yes.
But I would also like you to throw more light on the policies, because as much as we want to be sure that the organizations working in these sectors require that enabling environment from the government to continue to thrive and do the work they do to bring about positive outcomes in terms of nutrition. So what are those policies that have successfully enhanced the resilience of food systems and ensured measurable improvement in nutrition outcomes?
Thank you, the moderator. We have many policies that have been brought up by the ministry with the support of the federal government. Not even recently, even before now, there have been policies, though at times some of them will not last before being changed as a result of unstable government we have. Unstable in the sense that we have set of political party in the power today, another one come the other day, and they will not want to continue on what the previous party did. But that notwithstanding, we could remember the time of the period of National Special Program for Food Security. And that time, there was a success in it because the approach was improving the extension services and input supply that time to make sure quality inputs. That was the time the issue of manuring was visited, because before then, people saw the issue of using manure as going into old system, thinking that chemical fertilizer is the best because it has been an improved or modern way of supplying the nutrients. Yes, it's good, but the problem is we don't know many times what the soil needs before we supply the chemical fertilizer. In fact, that is one area that the ministry is focusing as well. I forgot to say it the other time. The ministry has developed what we call the National Soil and Water Laboratories, where we are trying to ensure that people in the country, they know exact nutrients the soil at a particular place is needed, so that what we call nutrient antagonism will not be happening in the soil. And this one will help reduce the cost of production, and at the same time ensure quality food, because the poison will be reduced from the food. It's not because they use chemical fertilizer that the food is poison. It's because the quantity required is not given. If the quantity required is given, it will not be poisonous to the body. But we give what is not needed. So apart from that special food program, we have our agricultural policies being updated every time. And I just mentioned the fertilizer policy that is still ongoing to monitor what is being used. And we have what I said the other time, the issue of a soil conservation program, which is becoming a policy that when we are talking of soil conservation, it involves making sure our soil is preserved. And one of the best ways to preserve the soil is to make sure it is not exposed to harsh weather or harsh condition. That is the impact of the climate. And that takes us back to issue of agroforestry, area forestation, making sure we go back to what we call multiple cropping, mixed cropping. You know, we thought issue of monocropping is a modern and more civilized. We open about 100 hectares of land and put only maize there. Immediately you harvest the maize, the land is empty, nothing there again. And that's why in the corn north, breeze will carry the land. And in the east, water erosion will wipe everything. And that has been a much concern. So making sure we try what we call mixed cropping is being encouraged as a policy now.
Okay, thank you. Our time is really fast spent, but we have just a few minutes to take one or two questions from our audience. So please, if you have questions for our panelists, please just signify by raising your hand. We'll be taking two, maximum of 2 questions, please. Yes, please, we have one question here. Yeah, please.
Okay, thank you, and good presentation from the panelists. I just want to ask the last speaker that what level of awareness has been done to our local farmers about how toxic or how dangerous these fertilizers are to the land. Thank you.
Okay, so the question is for Dr. Michael Adegboye. He's trying to know what level of awareness and sensitization has been done to the local farmers to sensitize them on the toxicity of the fertilizers.
Okay, thank you. One thing that we got was a policy in 2012, Agricultural Transformation Agenda. And through that, we started having good rapport between the Federal Ministry of Agric and the State Ministry of Agric. And that brought the Federal Ministry of Agric, prototype of Federal Ministry of Agric, into every state. If you can take note, in your state, you have Federal Ministry of Agric there, not departments of different agrics again. Federal Ministry of Agric in a location where all departments of agrics are. So, and we have a coordinator there representing the minister. And that coordinator works together with the Commissioner of Agric of the state and the ADP project manager. So there's no how the federal government can contact the farmers. So whatever we have, we package it to the state coordinators in the state. And the state coordinator lies with the Commissioner of Agric in the state and ADP project manager. They organize meetings for them, and even the support goes through that way. That is the way we are doing it. Okay. And series of training has been given. to farmers, even with backing it up with inputs. Like if they are trained on poultry production now, they will give them what they call seed to start at the end of the training. And if they train them on the use of chemical, they will give them the chemical and sprayer after demonstration for them.
All right. So, okay, we have one more question. But just before we get to your question, I would like to take some final thoughts, just in 1 minute, please. Hope, please tell us about the climate mitigation and adaptation funding. What for nutrition in Nigeria, what are those advocacy measures that have been put in place to, support access to the funding? Just in 1 minute, please.
Yes. So I'll just run through. One is data and evidence generation.
Okay.
When you collect, you do research and you generate data, you can use that to, make a convincing argument to policymakers and to your donors on the linkage between climate change and nutrition and the need for funding.
All right.
And for them, when you make these convincing arguments, you would show them the need to fund climate resilient nutrition program. We also have awareness campaigns. Like we have said, we've established, a lot of people do not know what climate is. If you ask the average Nigerian, I'm not stretching so far, they do not know, not because they do not want to know, it's because it's not out there in their faces. So more awareness campaigns will put this thing in their faces. Get the media talking about it. Get everyone talking about it. The government, partners, everybody, civil society organization, let us know the impact of climate change on nutrition. And lastly, I'll just say this quickly, capacity building, very important. Training civil society organization, government officials, and even community leaders, training them on and advancing their knowledge on climate change and nutrition and its impact on nutrition, and also building their capacity on how to access this funding by writing proposals that can meet the funding criteria. So yeah.
Thank you. Dr. Michael Eveshonya, in 1 minute too, please just tell us what are your learnings, major learnings from the policy environment while implementing, designing these nutrition programs across the sectors.
Okay, thank you. So for us, we have great learnings, but I will just, as you said, in 1 minute.
In 1 minute.
One of our learning is that engagement of the relevant government stakeholders in whatever you are doing. I remember when we came in, we have to go to the Federal Ministry of Agriculture to look at what are the priority areas that we can key into. I once had an experience in a particular state where a donor-funded program brought in a lot of seeds, and when the farmer planted the seeds, they just grew vegetatively before they start yielding. The rain had cut short. So you wasted your time and you wasted money and you bring down their hope. So when you engage with government very well, they will tell you exactly where the gaps are and what they have as priorities. Because as implementing partners, we are not supposed to be parallel to the government. We are supposed to work in line with the government. So that is one of the major learnings that really kept us to where we are today, by working with the government. But finally, for me, we need to increase awareness creation on early warnings on all aspects, but specifically now to the climate issues. Last year was a disaster. And if you have gone back to the CH analysis that was conducted in March, between this month of June, July, and early August, a lot of persons will be food insecure across over 18 states because of the heavy flooding that we had. The rains have started again. How many of those early warning signs are on our native tongues? How many of them are broadcasted the way Coca-Cola is advertising their products on per seconds, events? People don't still know that these things are here, and we hope that it does not happen, but we need to do the right thing first before we hope. Thank you.
Thank you very much. Early warnings and also organizations partners should not work in silo. They should not create parallel systems, but join with the government's blueprint to further the agenda that has already been put in place. And finally, Dr. James, what are your recommendations from the numerous efforts, the laudable efforts your organization is putting together? What are the recommendations to sustain these important lessons? In 1 minute also, please. Thank you.
Thank you. Well, key learning is that we believe now that private sector participation is key if you are going to improve nutrition outcome from our own perspective and our programming, just like we have demonstrated in Lagos. Okay? Then again, we believe also now that capacity building should be skill-based, not just knowledge. A lot of knowledge are out there, especially for the front-line health worker, but to translate it to practice at times become a challenge. So we need to do gap analysis in when we want to do a capacity building, to actually know, which area to focus, not on the general capacity building. At the end of the day, the sales remain the same. Finally, sustain advocacy, for resource allocation and equitable distribution. When resources are allocated, all right, maybe to a ministry, how is it distributed within the various arms of the ministry? It's also very key, so that, the nutrition outcome will not be jeopardized at the expense of some other program. Thank you very much.
Thank you. And just finally, before I wrap up, that very important question, please, let's have it. Thank you.
All right. Good afternoon, everyone. My question goes to Dr. Adeboye. So we have in the face of climate change, an increased demand on land due to population growth. How then can we farming practices such as shifting cultivation that improve soil fertility? We can no longer do it. So how then can we ensure sustainable food systems, especially for those at the bottom of the pyramid?
Okay, he wants you to recap the question, please.
Okay. No, we have increased demand on land due to population growth. So we don't, farming practices such as shifting cultivation, we no longer can do it to improve soil fertility. So how then can we have a sustainable food systems, especially for those at the bottom of the pyramid? Thank you.
Just as I said the other time, there are many things to do. Number one is for them to understand this issue first, the issue of this climate change, not practicing farming in the old way. That is by ensuring that they get improved seed, improved livestock strain of varieties. Not only that, when I say improved seed, modern one, then resistant seed, not only maturing early, but there is those that are resistant to some diseases, because as a result of disruption in the rainfall pattern, diseases have been encouraged, affecting both crops and animals. So not only that, the issue that I said the other time is very necessary. Having the knowledge of soil, and that is the area we have problem. We don't have investors in the area of soil. Our politicians don't support soil because they call it intangible project. It is not what they can see. They support crop, they support animals, but they don't support soil because they cannot see the nutrients. If they say they spend so amount on soil, what have you brought out? They cannot see it. So that is the problem we have. I remember in 1997, 1987, not 97. I was in the university, and the government then, former government President Ibrahim Babangida, invited some professors from different universities to come and deliberate in Abuja. Representatives from all federal universities, from the Ministry of Agric, to come and deliberate what is the problem of agric in Nigeria and what could be done. All of them, they brainstorm, and they suggested that soil is the basis of everything. If the problem of soil is solved, we will have enough crops, and we will be able to give excess of what we produce to feed animals. But now, can we produce enough food for ourselves? The rice we are producing is not enough. Our corn, not enough. How do we get feed now? I'm sure those in poultry will bear with me. A bag of layers feed now is over 8,000 per bag. Then how do you now sell your egg?
Actually, 9,000.
So that's the problem. We need to let them know. And you are here. Please, if you know any farmer that want to break even, let him come and analyze his soil so that we will know how to reduce the cost of production and be able to produce at the expected ton per hectare. Many of the farmers are producing far less when it is supposed to get about maybe 8, 10 tons per hectare. They are getting 2. Then how would they make it? How do we feed ourselves? So please, as you are here, help us pass the information. Let them come and they know the state of their soil to help them.
Wow, thank you very much for these insightful conversations, and I believe with more sensitization and capacity building, these local farmers will be able to maximize the capacity of production and also profit, and there will be adequate food and also nutrition for every Nigerian. Please, a round of applause for my esteemed panelists one more time. And I'll request we take a group photograph. Please, I would invite the Director of Programs, Nigeria Health Watch, Kemi, for a group photograph. Thank you.
Thank you so very much, Kachi, and the rest of the panelists. I'd like to recognize the presence of Dr. Aliyu Musa Yauri, Deputy Director and Head Education, Awareness and Outreach Division of the Department of Climate Change of the Federal Ministry of Environment, who walked in during this panel discussion. And now, because one of our key outcomes from this meeting is a white paper outlining key areas of discussion and recommendations, I'd like to welcome Oloma Omeje, Program Manager at Nigeria Health Watch, to guide us through this process. Thank you.
Good afternoon. Good afternoon, everyone. Thank you to the panelists and the participants, especially to the panelists for making it such an engaging session and opening our eyes to areas that we yet didn't know about climate change. Not to bore us with all the background of how climate change has impacted food production and how it has also impacted getting food to the last mile. Because beyond having affected, just like the last panel has said, having affected the quality of food that comes out, there's also that part of the food that actually gets to the last mile. And not to bore us with all that and how Nigeria is second place in the stunting burden across the world and the number of people that are hungry in Nigeria. Some of the things that has come out from this policy dialogue are the call to actions, I would call it, more like a recommendations that has come out that as partners, as people in government, to help alleviate the impact of climate change on nutrition outcomes in Nigeria. I'll just breeze over them, but the white paper will be disseminated to us on a later date. Some of the things that have come out from this is that we need to employ a holistic approach, not just a top-bottom or a bottom-top approach. We need to employ both to ensure that no level of people are left behind in the approach. And there's also the part of intensifying sensitization across board so that people are aware, just as Kemi had said. Some people are not even aware, especially the young people. Many people in the village are not aware about how climate change impacts their health, and also sensitization would go a long way to do this. And we also have improving the capacity of farmers. The last panel did a lot in more like explaining how it impacts our health in general. So strengthening their capacity, letting them know the impact of using inorganic fertilizers, and even the ones that are not using it in the wrong proportion, and how it will impact our health, and strengthening leadership, improving the evidence that is available as to how climate change affects nutrition, and all of those, empowering the youth, empowering the women, and legislature on the use of fossil fuels. And I heard the first panel mention about alternate power supply like solar to reduce the climate change, as it were. And aligning our stakeholders as the private sector, align with the government so that we are not working in silos. And these are just the summary of the call to actions, if you want to call them recommendations, or key takeaways from this. And we are going to fleshing them out and disseminate in the coming days. Thank you very much.
Thank you, Oloma. And now to bring the meeting to a close, I'd like to invite Tefia.
Thank you, everyone. Safia Shoaibu Isa, the lady that has been in your emails, bothering you, inviting you, thank you. So before I say anything more, we would like to have your feedback on this policy dialogue. Now, there's a QR code that should come on the screen, and I'd like to invite you all to please bring out your phones and scan the QR code. Please let us have your feedback about what you thought about this discussion. We are definitely going to take it to heart and use it to plan better. So it's the 6th month of the year. I mean, as organizations, we're all busy with media reviews and planning for the second half of the year. So I really want to appreciate each and every one of you that has taken the time to be with us despite your tight schedule. Dr. Ojo, Dr. Abdu in absentia, Dr. Adegboye from the Ministry of Agriculture, people from the Ministry of Environment, Helen Keller, you said, our partners. Again, we are so grateful. We really appreciate you. And from the discussions that have taken place today, I believe you would agree with me that we have only just scratched the surface. For me, I see this as a start of a series of engagement. I learned today that there's exclusive breastfeeding is connected to the climate. I learned also that soil is the most important thing that we need to actually improve our food security right now. And like Dr. Adegboye said, that, you know, it's easy how people can miss that opportunity and keep thinking about the crops, the animals that they can use to improve livelihoods. But if anything, the highlights and the unpacking that we have heard today point us that we are indeed just scratching the surface, and there needs to be a multi-sectoral coordinated response to changing the narrative for nutrition, for food security, and climate change is at the base of it. So again, thank you. And I want to tell you that I'll still be in your emails, I'll still be in your DMs, because we have just started. There's much work to do. Thank you again, and do have a lovely afternoon. Please stay for lunch. Don't leave. You said? Oh, yes. Please, a group photograph for all of us that are here.
Thank you, Sophia. So the group photograph will be here. Can we all please come out, and then we'll break for lunch? Sam? I think we need to move this.